हाँ बोलो मतलब सर। हाँ बोलो। व्हाट्सएप है ना सामने, हाँ ओके। आगे नहीं क्या मुझे सर लिंक। आगे आगे नहीं। क्या करूँ अब मैं बोलो। क्या बंद कर डालो बोलो। व्हाट्सएप पर। हाँ एक मिनट खाली है। नहीं नहीं रुको एक मिनट खाली है, मैं कॉपी कर लेता हूँ करवा दूँ। हाँ ओके अब कर डालो। ओके हाँ। एक मिनट मुझे सर खाली मैं यहाँ एक स्लाइड ऐड कर डालता हूँ, जस्ट 1 सेकेंड प्लीज गिव मी 1 सेकेंड। हाँ ओके ओके। बहुत बढ़िया बढ़िया। एक मिनट मुझे सर प्लीज। ठीक है मैं ओके मुझे सर वो एक मिनट में ये डाला दूँगा स्लाइड है। ओके ओके मुझे सर अब क्या करेंगे बोलो। अब हो गया ना पूरा। आई हैव टू जस्ट शेयर द लिंक नाउ। हाँ अब इट इज़ ऑन नाउ, एवरीथिंग इज़ ऑन। हाँ ओके ओके मुझे सर। इसे हाँ ओके ओके नो प्रॉब्लम। हाँ ये उड़ा डालूँ। हाँ नहीं उड़ा तुम्हें छुड़ा डालो। ओके बट दिस विल बी देयर। हाँ बट मिनिमाइज कर डालेंगे नहीं उसे। इसे मिनिमाइज नहीं कर सकते क्या मुझे सर। हाँ हाँ ओके अब ये सब चीज़ें। हाँ निकाल डालो, निकाल ही डालो, कुछ निकाल डालो। ये भी निकाल दो, निकाल डालो, ये भी निकाल डालो, ये भी निकाल डालो। हाँ नको नको निकालो, नको निकालो नको। अब हाँ अब देखो अब ये अब ऐसा छोड़ डालेंगे नहीं। हाँ 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 स्टार्ट रिकॉर्डिंग जब शुरू होती है तब। हाँ अच्छा स्टार्ट रिकॉर्डिंग कर तो। हाँ हाँ अब नको व्हेन वी स्टार्ट द मीटिंग आई विल स्टार्ट। वो रिकॉर्डिंग मेरे लैपटॉप में होता है क्या वो। हाँ, लैपटॉप में होता है, ओके। बट तुम्हारे इसमें यूट्यूब अकाउंट में भी होता वो? कहीं को आने रखा तो वो, आई डोंट नो। कौन भी क्या भी नहीं है उसमें आवाज, यूट्यूब चला को दिखाऊं क्या? तुम्हें चलो क्या तभी।
Grammarly does more than catch errors. With Grammarly, you can find really good.
अच्छा, तुम्हें उसमें देखे, फोन में देखे लिंक ऑन कर को? हाँ 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 हाँ, ओके बस, ओके। हाँ, अब और अच्छा आ रहा है, ओके। डन। अब छोड़ो, मैं शेयर कर देता हूँ लिंक, टाइम भी हो गया है ज़्यादा। हाँ, व्हाट्सएप में भेजो तुम्हें लिंक मुझे। भेजा नहीं भेजा है अभी तक क्या? हाँ, मैं उसे शेयर कर लेता हूँ ग्रुप में। हाँ 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 हाँ, वॉच लास्ट लास्ट वन। ओके ओके। हाँ हाँ, वॉच मैं कर लेता हूँ, ओके। हाँ, ओके। ओके मुझे सर, ओके, थैंक यू, अच्छी बात है। अल्लाह हाफिज़।
चर्चे पार्टिसिपेंट कैसा मालूम
तो करते
आंध्र प्रदेश से 7:30 तो ये लीव कर लेंगे
एक लिंक भेजती हूँ वैक्सीन लिए बाद का केयर लेने का कहते हैं जूम मीटिंग है 7:30 को मुझे फोन आ जाता है बराबर 7:30 को
तो मैं बैठ नहीं होगा ना 7:30 3 मिनट
3 मिनट 8 मिनट ही चुके
अच्छा वो
मैं तुम्हें भेज रही हूँ देखो करीम से ज्वाइन करो करीम से एकदम नहीं तो कट हो जाता है कॉल आया तुझसे क्या है तुम्हारा नाम है मुझ नहीं हो गया ना
COVID vaccine facts and myths and post-COVID care. Nice to meet you. Okay. 5 p.m.
डॉक्टर से
5 p.m. कैसे जमत का इंडिया में ये मैं
क्या है डिस्टर्बेंस क्या है
रिजल्ट का जाकिर भी डाला ना बुक कर ले लो कोविड वैक्सीन
डॉक्टर्स हामिद सिद्दीकी अल्ताफ अहमद शिफा हॉस्पिटल बेंगलुरु उनका
ऐसा जैन करना तो दबाना छोड़ो
वो लिंक के पर मारो
launch meeting click open the paper launch meeting
अस्सलाम वालेकुम
सलाम।
मैं हामिद बोल रहा हूँ। मेरा वीडियो आपको आ रहा है?
नहीं आ रहा अभी,
आ रहा है
मुझे नहीं आ रहा। मेरे इसमें जूम नहीं है, कभी नहीं आ रहा।
तीन है जूम में
नहीं
भाई, लिंक क्लिक करे तो आ जाता है।
नहीं आ रहा ना। डोंट हैव जूम क्लाइंट इंस्टॉल, डाउनलोड टू कैन जूम कर पाए। मेरे टैब में ये नहीं है मेरा।
फोन में लिंक देखो।
नहीं है इसमें जूम नहीं है मेरा।
हामिद आ गई।
अस्सलामुअलैकुम।
वालेकुम अस्सलाम व रहमतुल्लाहि व बरकातहू।
क्या हाल है डॉक्टर साहब, डॉक्टर सोहेल साहब?
जी जी अल्हम्दुलिल्लाह, अल्लाह का करम है।
खैर खैरियत?
अल्हम्दुलिल्लाह अल्हम्दुलिल्लाह।
आओ, मौसम अच्छा है, सूप पीएंगे। बारिश पड़ को जरा अच्छा ठंडा ठंडा है।
नहीं नहीं नहीं, एंजॉय करो।
गरम गरम सूप
नहीं
पीने
नहीं,
जाते हैं।
तुम्हारे पास ठंडा ठंडा है मगर यहाँ बहुत गरम गरम है।
अच्छा अच्छा।
ओके।
अस्सलाम वालेकुम रहमतुल्लाहि वबरकातुहू। खैरियत भाई?
वालेकुम अस्सलाम व रहमतुल्लाहि व बरकातहू।
वालेकुम अस्सलाम।
Good to see you भाई। Last week we met it।
कौन कहते हैं सवाल है? कहते हैं कौन कहते क्या पूछने क्या है तुम?
वालेकुम।
आप भी तो करे वो मैं बहुत होगा
वालेकुम सलाम।
वालेकुम अस्सलाम।
तक को चल रहा
मीटिंग
इधर हमारे ऑलरेडी इधर
सोहेल भाई ऐसा करें, जो भी लॉगिन हो रहे हैं म्यूट कर दो।
हाँ जी जी, मैं वही कर रहा हूँ, वही कर रहा हूँ।
डिफॉल्ट म्यूट।
जी जी जी, म्यूट कर दे रहा हूँ।
Assalamu alaikum.
Waalaikum assalam wa rahmatullahi wa barakatuh.
Dr. Saab, Dr. Suhail,
Yeah, ji, Dr. Saab.
before you start, why don't you give an introduction of BENFA?
Yeah, I have a small, very small presentation as well of BENFA. Now,
Why don't you give a brief introduction of BENFA?
yes, Dr. Saab, I will, inshallah. I will. There is one person, Classic Events. Classic Events has risen his hand. Can you please tell me? Unmute and tell. Classic Events. Somebody, Classic Events.
Yeah, by mistake कुछ राइज किए होंगे उसमें, I think by mistake.
Okay. All are mute, but I am not able to understand from where the noise is coming.
Oh, mashallah.
Shall we wait for a while or can we start the program? Because now it's sharp 5 p.m. Shall we
wait for the 5 minutes, I think. Just to give the 5 minutes, people are lagging.
Okay.
Yeah.
Assalamualaikum.
Waalaikum
Assalam
assalam.
warahmatullahi wabarakatuh.
Suhail Saab, if the organizers are there, we will start.
Yeah, but it's sharp 5 p.m. now. I think we can give 5 more minutes as grace.
Fine. No issues.
Waalaikum assalam सोहेल साहब सबको म्यूट कीजिए आप
जी एक मिनट कर देते हैं क्या हो रहा है the people who are joining that's the anyway
ओके जब ये स्टार्ट होगा तब भी ये कर सकते हैं
जी when we start I'll mute everybody Alhamdulillah 100 participants have joined so far.
Yes. Century, we crossed the century.
Yeah, right now we are at the century. So we'll cross the century and we'll start the session inshallah.
Inshallah.
There is live streaming on YouTube as well of this meeting.
Boil on cake. Just boil on cake. I can try to. Let me know.
இருக்குதா நாய் இருக்கா? நாய் இருக்குதா?
This wasn't just a fight.
In the name of Allah, the most gracious and the most merciful. It is my pleasure and honor to welcome everybody who are present in this seminar organized by BENFA Charitable Trust under BENFA Health Education Program. And we are thankful to everybody who have given their precious time and joined us to discuss a very, very important topic of current scenario, that is COVID vaccine and post-COVID care. Before we start our specific session of today, I would like to give a small and very short introduction of BENFA to the new members who have joined today. BENFA was founded on 10th October 2020. BENFA Charitable Trust, registered under Indian Trusts Act, is a non-profit organization, a public charitable trust focusing on education, healthcare, and socio-economic empowerment of underprivileged segment of the society. What is BENFA? In Kannada, it is Bengaluru Snehitaru. Bengaluru Snehitaru. And BENFA is short form of three words, Bengaluru Friends Alliance. And our motto is, a little support can change lives. We believe that to change somebody's life, there's no need to give something big. Even small, little supports, like guidance, small support, moral support, counseling. These things can also change life. But as of today's current scenario of COVID crisis, we can modulate this motto into a little bit higher level. That is, a little support can save lives as per today's scenario. We have our head office, that is administration office, at HBR layout, first stage. This is our address and contact number of our head office. It's on the second floor on the 80 feet main road of HBR layout. We have our welfare center of Bengaluru North Division. Address is just opposite to Ambedkar Medical College OPD block on Shampur main road. This is our welfare center. It was inaugurated by our ex-IPS Dr. Mr. Nisar Ahmad Sahab. You can reach us at email contact@benfa.org. Our website is www.benfa.org, and mobile and WhatsApp, this is the number 9611834443. You can reach us on these numbers and this email ID. So because today's we have a very important session to go, so I would not waste much of time on the introduction of BENFA. That can be done any other time in future, inshallah. If any new member wants to interact or wants to know about BENFA, please reach out us on our email ID or WhatsApp or on our mobile. We are 24 hours available to our members. Coming to the today's program under BENFA Health Education Program, the topic is COVID vaccine myths and facts and myths, and post-COVID care. The speakers are Dr. Hamid H. Siddiqui and Dr. Altaf Ahmed. Why we chose these two topics? One is COVID vaccine, that is prior to the occurrence of the disease, prior to the occurrence of the COVID. And our next topic is post-COVID complications and its care. We have completely taken out the COVID period, the disease period. The major reason is that since wave 1, almost 1.5 years, there is lots and lots of information available on the COVID disease, COVID virus, how it spreads, once it enters into the body, what happens, what is the, what are the signs, symptoms, and what is the clinical manifestations, how to treat this. All this information is available. But two topics, that is before of course you wear a mask, maintain social distance, these things are there. But nowadays there are lots and lots of misconception and myths regarding COVID vaccine, due to which many people are reluctant to take COVID vaccine, which is very dangerous, very harmful to the society. So today, to clear this give more information on the facts and to clear these misconceptions and myths, Dr. Hamid Siddiqui is there with us, inshallah. Then coming to the, just leave the COVID, we know what happens, fever come, cough, shortness of breath, saturation falls, go to hospital and all those things. But in recent times, mainly in the wave 2 of COVID crisis, there are many things have happened after the COVID, post-COVID complications. There are many incidences there where the people have died due to post-COVID complications. Patient had COVID, he recovered, he went to the hospital, took treatment, alhamdulillah, he came back, he's all right. But he died. Why? He died because of complication. He did not die because of COVID. There are many other complications which can arise after the COVID. So how to take care? What are the complications and how to take care of these complications? Dr. Altaf Ahmed Sahab is there with us to give explain us about this part. Now we shall start with our first session, that is COVID vaccine. Dr. Hamid Siddiqui, basically he did his medical graduation from MRMC Gulbarga, Karnataka. Then he did his residency from Creighton University, Omaha, United States of America. Then after that, he has done a lot of various fellowships, and he worked as faculty physician, staff physician in various hospitals in the United States. And today, currently he is working in Cleveland Clinic, Abu Dhabi. I request our Dr. Siddiqui. First of all, I would like to thank and with gratitude to Dr. Hamid Siddiqui Sahab, who accepted our invitation to give this seminar, and he's sparing his precious time with us. Thank you very much, Dr. Hamid Sahab. I request you to take on the dais, Dr. Hamid Sahab. Please, you unmute yourself, Dr. Hamid Sahab. Dr. Hamid? Yeah, please unmute now.
Okay, can you hear me now?
Yeah, we can hear you.
Is my voice clear? Okay, all right. I ran into a little bit of technical difficulty there, but thank you. First of all, Assalamu alaikum wa rahmatullahi wa barakatuhu.
Wa alaikum assalam.
I want to thank all of you for giving me this opportunity. I would like to start by giving you a little bit of background about myself. By training, I am a pulmonologist and an intensivist. So I'm a lung specialist and also an ICU specialist. And due to the nature of my work, I was thrust into the COVID pandemic and was involved in taking care of many COVID patients, particularly in the first wave. As was mentioned to you, I live and work in Abu Dhabi, which is in UAE, and I work for Cleveland Clinic Hospital over here, Cleveland Clinic of Abu Dhabi. We are a government hospital and we are a tertiary care center. And during the first wave of COVID last year in March 2020, we were designated as one of the COVID centers in Abu Dhabi. We only had one of the largest ICUs in the country with 72 beds, but for the sake of COVID, we expanded our ICU bed capacity to 110 beds. This is just ICU beds. Along with this, although we are a government hospital and particularly cater to the local Emirati population, for the sake of COVID, the government of UAE, the government of Abu Dhabi in particular, opened their doors to all comers. So we were offering free treatment for COVID to anybody who was even visiting the country on a brief trip. As most of you are aware, UAE is a rather wealthy country and they're not short on resources. And particularly during the time of COVID, we experienced this. The government spared no expense in taking care of these COVID patients. We never ran short of any supplies or medications or PPE, even to the point of we were not short of doctors or nurses. When we started to get busy, they started bringing doctors from abroad, including India, including USA. This was the extent of the commitment of the country to treat COVID. There is a reason why I'm telling you all this. Please hang on. As you know, during the first phase, many drugs were touted as being the cure for COVID, from hydroxychloroquine, from tocilizumab, from remdesivir was not available at the time over here, but we had dexamethasone, we had favipiravir, we had plasma cell therapy was available to us, stem cell therapy was available. Any treatment you can think of that was being used at the time, we had it available. And we never ran short of any of these medications. So alhamdulillah, we were able to treat our patients as we felt fit, and we were able to provide them the care that was being provided in any center anywhere in the world. The reason I'm saying all of this is, despite having all of these resources at our fingertips, some of our patients died. We could not save everyone. And this is because once COVID spreads and your body becomes weak and your immunity goes down, your other organs also start failing, and then no amount of medicines will help you. Please do not misunderstand what I'm saying. I'm not saying that medicines are useless or the medicines don't work. No, what I'm saying is, after a certain point, the medicines do not work. Let me give you an example that will clarify this and will also inform you how medical research works. There is a drug out there that is being touted as a cure for COVID, and that is tocilizumab. Tocilizumab is a monoclonal antibody that works against IL-6. And we have been using this drug for a while, and there is a recent study that came out in March from UK that showed that tocilizumab definitely works and helps in treating COVID patients. So let's take a look at this study to understand, how we came to this conclusion and how effective tocilizumab is. I'm using tocilizumab as just an example, but all the other drugs that you see that are being used for COVID have similar studies showing that they're effective. In this particular study that was published in The Lancet, they took 4,000 patients. All of these 4,000 patients were severely sick with COVID. They were on oxygen. They were all requiring oxygen. See, these are not mild COVID cases. These are not the cases you see who are just having a little bit of fever and chills and body aches and sitting at home. These are all patients whose lungs had been affected and had become compromised and their oxygen numbers were low. And these are all hospitalized patients. They took 4,000 of these patients and they divided them into two groups. The first group was treated with all of the usual medicines we give for COVID, including oxygen, including IV fluids, including dexamethasone, including remdesivir, everything, except they were not given tocilizumab. The second group was given tocilizumab and the other treatments. Okay, let me rewind over here. So two groups, 2,000 in the first group, 2,000 in the second group. The first group is not given tocilizumab. The second group is tocilizumab. And who got tocilizumab, who did not, was not known to either the patients or the doctors. This is what we call a randomized controlled clinical trial. This is how we determine in medicine whether a medicine works or not. There are many more nuances to this. I'm just giving you the big points, but this is how we do a study. And the more number of patients you have, the more reliable are the study findings. This happens to be, as far as I'm aware, the largest study for tocilizumab. And this is why the findings of this study trump the findings of any of the other studies for tocilizumab because they are smaller. And this is why we never trust any medicine that has only worked on one or two people. We want to see it work on many people to derive reliable results. Now let's see what happened with these patients. These patients were then followed to see what happened eventually. At the end of the study, they found that out of the group that did not receive tocilizumab, but received everything else, they received dexamethasone, oxygen, and remdesivir, and all of that. In this first group, 35% of patients died. Okay, 35% of patients died in the group that was not given tocilizumab. In the second group that was given tocilizumab, 31% patients died, so a difference of 4%. The researchers were happy with these results, and they published the results, and they announced to the world that tocilizumab is a good medicine. You should use it. It saves lives. And indeed, they are correct. But let's look at it from another standpoint. Despite using tocilizumab, despite using oxygen, despite using all of the other drugs that were available to them, 31% of patients still did not make it. This is what I mean by when COVID is advanced and starts affecting all of your body, particularly when it starts affecting the lung, then causes the oxygen numbers go down. We don't always know whether the medicine will work or not. That is a point too late. In this situation, our responsibility should be to try and not get COVID in the first place. This should be what we should be striving for. We should try to not get COVID in the first place at all. Because once you get COVID, Allah alam, who Allah knows best who will survive COVID and who will not. Worldwide, the mortality from COVID is 1% to 2%. But as Dr. Altaf will probably say in his talk, even the people who survive have complications and problems that lead to diminished quality of life. So how can we stay away from this deadly disease? Apart from praying to Allah subhanahu wa ta'ala, and He's the first one who can protect us from the disease, apart from that, and apart from social distancing, which is wearing masks, washing your hands frequently, staying away from, keeping a distance of 5 or 6 feet from anybody around you, avoiding gatherings unless they're absolutely essential. So apart from social distancing and apart from prayers, which are of course very helpful, the one medicine we have that is we can use to help us from getting COVID are vaccines. And yes, I'm calling it a medicine. Now let's take a brief look at how vaccines work. Traditionally, there have been two types of vaccines. We have the killed vaccines and we have the live vaccines. Now, I know there are some medical people in the group and this will be very basic knowledge, but I just wanted everybody to be on the same page. So let's see how vaccines work. When it comes to a killed vaccine, what they do is you take a virus and you inactivate it or you kill it. And then you give this killed vaccine, you introduce it into the body of a recipient or of a patient. Once the virus is inside the body, and remember, this is a killed virus. This virus cannot give you any infection. This virus cannot make you ill. However, as soon as the virus enters the body, our immune system kicks in. Our immune system recognizes that this virus is not part of the body. This virus is a foreign entity and starts making antibodies to attack it, to neutralize it. Once these antibodies are formed, they stay in your body and inshallah will protect you when you face a real virus in the future. So next time, once you have antibodies formed in your body, the next time you're faced with a person who has the infection and you come into contact with the virus, your body immediately boosts up this antibody production, neutralizes this virus, and either you get no symptoms or you get mild symptoms. There are very, very few cases of patients getting severe symptoms of COVID after the vaccine. Okay, this is how a killed virus works. In terms of a live virus, what they do is they take the virus and they weaken it. We call it a live attenuated vaccine. They weaken the virus so much so that it cannot really cause an infection in you. And then you introduce this virus into the body through an injection. The immune system again kicks in, makes antibodies, and then you're protected from a real infection when it comes along. These have been the two traditional types of vaccines. There's a third kid on the block, which I should mention over here, and this is the mRNA vaccines. Now, I know mRNA vaccines are not available in India at the moment, but it's possible that they will be coming to India. But they are available in many other countries, and there's a lot of talk on social media about mRNA vaccines. So I believe it behooves us to understand a little bit about how mRNA vaccines work. By the way, mRNA stands for messenger ribose nucleic acid. mRNA is not anything new. I have been reading about mRNA since I was a kid in high school. We know how mRNA works. The only thing new about this technology is mRNA has never been used to make vaccines. Now we're using to make vaccines. But scientists have been preparing for this for a long time. And why is that? Because the mRNA technology affords them an advantage that is not there with the other traditional vaccines. And that is, you can make the vaccine in a much, much shorter duration of time. There are technical details that I don't want to get into about why this is the case. But basically, with the mRNA technology, what you do is you bypass many of the steps of vaccine production by making the body do all the work. So mRNA is in this technology, what they do is they take a small piece of the genetic material of the virus, just the genetic material, not the entire virus, which codes for some important protein in the virus. And then they synthesize an mRNA molecule based on this genetic material. This mRNA is then introduced into the body. The mRNA is then taken up by our cells and produces this protein, which is present on the virus. Just a protein. Usually in today's COVID vaccines, they're using the spike protein, which is the protein found on the surface of the virus. Once our bodies recognize the spike protein, they make antibodies against it. And these antibodies then stay with you and protect you against future infections. Now, I know there was a lot of technical details, and you don't have to know all of that in detail, and there are lots of YouTube videos that can explain this much better than I can. But suffice it to say that mRNA vaccines have been found to be extremely effective. mRNA vaccines cannot give you COVID. They cannot cause COVID infection in you. And mRNA vaccines have an efficacy rate of about 90 to 95%, which has not been seen with traditional vaccines. I personally believe that mRNA vaccines will probably be the way we make vaccines in the future for many other types of vaccines. By the way, a common question that comes as do the mRNA vaccines affect your own genetic material? Does it affect your DNA? The answer is no, absolutely not. mRNA never enters your nucleus where the DNA is present. So there's not even a chance of it affecting your DNA or altering your DNA in any way. All right? So this is how vaccines work. And they've been found to be very effective in many different parts of the world. An example I would like to give here is of Israel. you might have read in the news about how COVID was raging in Israel even a few months back. And Israel had the same problems that we face in our countries. There are many people who were not following any social distancing laws. People were having large get-togethers, including religious get-togethers, like we had the Kumbh Mela. This was happening in Israel too. They were having infections of like rates of about 10 to 15,000 new cases a day, which I know doesn't sound like a big number for us in India, but for their country, that was a big number at that time. And then as soon as the vaccines became available, Israel purchased the vaccines and started a massive vaccination campaign throughout the country. By the way, they used the help of rabbis to convince many of their religious population that the vaccines were effective. And this played a major role in vaccinating a large number of people who were skeptical about the vaccine. The bottom line is, once they had vaccinated about 40, 50, 60% of the population, the infection rates started to fall down precipitously. From having 15,000 cases a day, in a matter of 2 or 3 months, the new cases dropped down to 40, 50, and 100 a day. Now it's almost as if there is no COVID and they've gone back to all activities like they did pre-pandemic levels. This is not a story unique to Israel. This is a story that is being seen in many different parts of the world, including USA. USA, as you all know, was very hard hit with COVID. It is still, I think, the number one country with the largest number of overall cases. Maybe India has taken over now, I don't know. But I have been following the news in US because I have family living over there, and they tell me how the infection rates have gone down, vaccination rates have gone up. Almost half of the US population is now vaccinated, and the case loads are going down precipitously. This is my message to all of you. We have to try and take the vaccine as soon as it is available. I personally have taken the vaccine myself as soon as it was made available to us in UAE last November. I was the first one in my family to take the vaccine. I then had my wife take it. My sister and brothers have taken it. My brothers-in-laws have taken it, and their families have taken it. About 40 or 50 people in my extended family so far have taken vaccines, and different vaccines. Some of them have taken Sinopharm, some of them have taken Pfizer, whatever was available at the time. Alhamdulillah, all of us are protected, and Alhamdulillah, none of us got any serious side effects. On the other hand, in my own extended family, about 50 or 60 people so far have contracted COVID. Most of them have recovered, but there have been 6 deaths so far. One of them just happened today. COVID kills. The vaccine does not. The vaccine is there to protect you. अगर आपको किसी चीज से डरना ही है तो कोविड से डरें, एक मामूली से वैक्सीन से नहीं। बस यही मेरे लिए आप सब लोगों के लिए पैगाम है, और मैं आप सब लोगों से रिक्वेस्ट करता हूं कि आप जल्द से जल्द ये वैक्सीन लें, जो भी वैक्सीन आपके पास अवेलेबल हो, या कोवैक्सीन हो या कोविशील्ड हो, और दूसरों को भी इल्तिजा करें कि वो भी वैक्सीन लें। यही एक तरीका है हम अपने अहबाब को और खुद को इस बीमारी से बचा सकते हैं। With that, I will stop, and I want to give some time for question and answers, but I'm sure there'll be a lot of questions about this.
Assalamu alaikum. I can ask the question?
Yeah, you can. Just
Jazakallah.
I would like to give little guidelines about the question and answer. Before we move on to the second session, the question and answer session is open now to Dr. Hamid Sahab. Please raise your hands so that we'll call one by one to avoid chaos. Now, first raise your hand so that I'll call the name. Now, yeah, Farha Diba.
Yeah, I had a question regarding vaccination for people who have bleeding disorder or factor deficiency, doctor. How is it safe? Is it safe?
Yes. So the question was about giving the vaccine in bleeding disorders and factor deficiency. So if you can specify exactly what the bleeding disorder is, I might be able to answer that question more accurately. But
this is for people who have factor VIII deficiency. With cuts, they start bleeding and the bleeding doesn't stop and all that,
Okay.
Maybe,
okay.
Yeah, for people like that, bleeding disorder. Yeah.
I see. Good question. To be honest, I haven't heard of any contraindications to not give vaccines to patients with hemophiliacs, but I would suggest in this case, refer to your hematologist. And I think I should have mentioned this with the AstraZeneca vaccine. There have been some rare cases of blood clots, not bleeding disorders. But these are exceedingly rare. We are talking about, maybe 1 in 100,000.
Yeah.
So 99,999 people who get the AstraZeneca vaccine also do not develop these complications. But to be honest with you, I don't have any information for hemophiliacs. I would suggest you talk to your hematologist about this.
Yeah, Jazakallah khair, doctor.
Sure.
But what about the Indian-made vaccines like Covishield and Covaxin? How safe are they?
Yes, so the Covishield is nothing but AstraZeneca. It is just being marketed under a different name in India. It is a vaccine that has been used in many countries all over the world and has been shown to be very effective and safe. Covaxin is an Indian vaccine manufactured in Hyderabad. Now, the phase 2 trial, the phase 2 results from Covaxin have been very encouraging. This is a killed vaccine, so it should be completely safe. And I should also mention there are no animal products used in the manufacture of this vaccine or Covishield for that matter. So as far as side effect profile is concerned, we don't have all of the data yet because it is not published. But for what we know that the company has published, the side effect profile is minimal. There is no reason for us to suspect the side effects will be high because all of the ingredients they use are what we use in traditional vaccines anyway. So yes, to just answer briefly, the vaccines are safe.
Jazakallah khair.
Yeah, thank you, Mrs. Farha. Now I request Mr. Ramesh Shinde to ask his question. Please unmute yourself, Mr. Ramesh Shinde.
Sir, good evening. Namaste. My question is, those who are having history of bronchitis, asthma, what are the precautions we have to take? And the second question is, what is the we have to keep our lungs to be healthy. What should we do? This is my question, sir. Thank you.
Okay, so good question. The question is, what do I do if I have asthma or bronchitis or any other lung disease, chronic lung disease of such? All right. So the answer is take the vaccine. And let me explain that. If you have a pre-existing lung disease and you happen to contract COVID, your symptoms will be much worse. The vaccine will not give you COVID. The vaccine will protect you from COVID. I would, in fact, argue that if you have lung disease, it is more important that you take the vaccine than someone who does not have lung disease. And this is what I've been telling our patient, and this is what we discussed. We have like a group of 10 lung doctors in my hospital. We all sat down in a meeting and discussed this. All of us felt the same thing, that if you have lung disease, you should be the first one to stand in line and get COVID vaccine. Particularly the killed COVID vaccines like Covaxin are safe. They will not cause any lung damage to you. They will only protect you from COVID. Now, what can you do to protect your lungs in general? Number one, avoid smoking or anything that inhales in, any sort of inhalational recreational drugs that you use. And number two, take whatever vaccines are available to prevent lung disease, including the flu shot and pneumonia shot. That is what we traditionally recommend to all of our patients with lung disease.
Okay.
Next question.
Next, I request Mr. Sharif Mohammed Hamid.
Assalamu alaikum. Doctor, I have a question here to ask. One thing is like post-COVID, how many days we have to wait for vaccine? So that is one question. And second question is, my mom has asthma and also heart stroke as well. So her age is 65 plus. Is it okay for her to take the vaccine?
Okay, so let me answer these two questions. So I'll answer the second question first. The second question was, can your mother who has asthma and maybe heart disease, or I don't know if she has diabetes or not, can she take the vaccine? Absolutely, yes. Okay, so your mom should get the vaccine and she can take it. The first question was, how long should I wait post-COVID to get the vaccine? So the answer here is going to vary depending on who you ask. I would say once you're completely recovered from COVID, which could take a few weeks or maybe a month or two, it is safe to take the vaccine. Some people will say wait a month, some people will say wait 3 months. But the bottom line is you should have fully recovered from all your symptoms. Once you're fully recovered from all your symptoms, which may take a month or so, you can take the vaccine. It should not be a problem.
Okay. Now I request Mr. M. Sudarshan to ask his question.
Thank you, Sushmita. Thanks a lot for the presentation and awareness. I hope I'm audible.
Yeah, you are audible. Yeah,
yes,
please go ahead.
My question is on mucormycosis and how effective are Covishield and Covaxin against these the new black fungus.
Okay, good. So mucormycosis and vaccine. So mucormycosis is a fungal infection that happens usually in people who are recovering from COVID or are very, very sick from COVID. And I believe Dr. Altaf might talk about this in his lecture. Vaccines will help you from getting COVID in the first place. If you don't get COVID, you should not get mucormycosis at all. Am I making that clear? So if you don't get COVID in the first place, you don't have to worry about any of the complications that you get after COVID. So yes, vaccines will help you from not getting mucormycosis, particularly in the post-COVID situation. Now, you can also get mucormycosis due to other diseases like bad diabetes or immunosuppression. Of course, the vaccines will not help you in that regard. But most of the mucormycosis cases that we're seeing nowadays in India, by my understanding, is happening in the post-COVID patients. And in this situation, yes, the vaccines will help in preventing you from getting COVID. And if you don't get COVID, you should not get mucormycosis.
Yeah, it's a good sequence. You take vaccine, no COVID, no COVID, no complications. No complication, no mucormycosis. Yeah, it's that way. Hope it is clear to you, Mr. Sudarshan.
Yes, thank you.
And Dr. Altaf Saab will talk more on this because his topic is the complications after COVID. Later on in the next session. Now I request Mr. Syed Mubin to ask his question.
Assalamualaikum, Dr. Saab. This is just a typical question. See, a family of 4, which like husband and wife are eligible and one daughter is eligible. So we 3 of us take the vaccine, let's assume. So the kid is not eligible. So is there any risk in that aspect?
How old is the kid, by the way? I'm just curious.
Around 12 years, 12, 15 years.
Yeah, so this is the exact same situation in my house. All of us have taken the vaccine except my 12-year-old, my 11-year-old rather. No, there should be no problem. In fact, this is the one silver lining with COVID. Children, even when they get the infection, recover very quickly. So if you have to prioritize who should get the vaccine in your household, start with the oldest people because they are the ones who are most at risk. The younger ones, in my humble opinion, even if they don't get the vaccine, I'm not too worried because even if they get the infection, very rarely does anything bad happen to them. In fact, in one study, I recall, they saw that nobody under the age of 20 died from COVID. This is an older study. But it's very rare for people to get really sick with COVID if they are young, if they are under 20. So I wouldn't be too worried about the young ones. And I guess the question you're asking is, if we all take the vaccine, will the younger one be affected? No. The younger one will not have any symptoms of COVID or either infection because of your immune response. I want to clarify one thing over here. A lot of people, talk about side effects of the vaccine. And when you take a vaccine, it is not uncommon to get myalgia or body aches or fever or headache or soreness. I don't consider these side effects. This is actually a sign that your vaccine is working. And how much of these symptoms you will have, it varies. Some people will have very minor symptoms. I just had a slight soreness in my arm and that was it. Some other people will be sick for a day or two, but that's okay. This is just a sign that your immune system is working. And you cannot pass on these symptoms to anybody else.
Thank you, Dr. Sir. Thank you.
Okay. Now I request BAFA 104A. That's what is written here. BAFA 104A.
Hello. Can you hear me?
Yeah.
Yes, I can. Go ahead.
Yeah. Please let us know who should get CRP done before vaccination.
No one. So let me clarify that. So the question was, who should get CRP before vaccination? You do not need CRP. CRP stands for C-reactive protein. It is an inflammatory marker. It is just one of the tools we have to see what the level of inflammation is in your body. But we don't recommend doing any test before a vaccine as long as you are having no symptoms of any disease. If you're not feeling ill, if you're not having a fever, if you're not having any body aches, if you're not having any respiratory problem, if you are feeling fine, go ahead and take the vaccine. No need to do any blood test before the vaccine.
Okay. In case a patient has macular degeneration and glaucoma, so should he go ahead with the vaccination?
Absolutely. Macular degeneration and glaucoma pose no contraindication for the vaccine.
Okay,
you
thank
can
you
get
so
the
much,
vaccine.
Doctor.
Yes.
Jazakallah khair.
Now I request Mr. Saqib to ask the question. Mr. Saqib.
Assalamu alaikum.
Wa alaikum assalam.
My question is that my dad actually had the first dose of Covishield in India, and straight after that, maybe within a couple of days, 2 or 3 days later, he presented symptoms of COVID, which we thought were the side effects, but eventually it turned out to be COVID. So he is, alhamdulillah, recovered now. But I was wondering if he is able to take the second dose later on after, when is my question actually, and if he can take it all, he has to start from the beginning again.
So good question. Let me clarify one thing first though. I don't think your father, I don't think. I'm pretty sure your father did not get COVID from the Covishield. It's just not technically possible for that to happen. Most likely, he contracted COVID from someone else, and it just happened to be around the same time. Now, how he got it, we don't know. I've seen quite a few cases like this, but this is not related to the vaccine. Now, I'm glad your father has recovered. I would wait till all of his symptoms have completely subsided. Maybe a month or 2 months after that, you can take the second dose. Now, I know the gap in this case is going to be higher than what is normally recommended. But, this is something that is being researched on an ongoing basis. And some vaccines, actually, it may be better to wait a little bit longer rather than have a very short duration. So I would say wait for another month or two after he's recovered, and then you can take the second dose.
Inshallah. I have another question.
Sure.
So relating to the same thing. So obviously he's taken the first dose and then I understand it probably was a coincidence, and that's what I argue with my family anyway.
Yes.
And because he has taken the vaccine and then he got infected with COVID, would he have any post symptoms? I know there is a talk afterwards. I was just wondering.
Yeah, I will defer this to Dr. Altaf as he'll be talking about this. There is a lot of talk about, post-COVID complications. Given the number of cases we have, I should say not everybody gets post-COVID complications. Many people do rather well. So we'll just have to take it on a case-by-case basis. And I'll defer this question to Dr. Altaf since he's going to be talking about this anyway in his talk.
Inshallah. Jazakallah khair.
Okay, now I request Asima Begum.
Sahil sir, I'm extremely sorry to interrupt you. My battery is running at 8%.
Yeah, please come on. Sajjad Ahmad, right? Sajjad Ahmad?
Yes, Sajjad.
Yeah,
yes,
please,
I have
please.
one question, sir.
Please go ahead.
Yeah.
Yes, go ahead.
Thank you so much for allowing me, Ali. Jazakallah khairun, Dr. Sir, for giving us a time. I am a diabetic patient. My age is 35. I got COVID. So, as you have informed that already in the past question that we have to take the vaccine, but once we completely cure. So how can we confirm that we are completely okay? As per my body symptoms, how I used to be earlier, same I am feeling now. So when I can take the dosage?
When did you get the infection? Approximately.
I got it last month, 20th.
Okay. So if all of your symptoms of fever, cough, shortness of breath, body aches, If all of these have completely gone away, then you can take the vaccine.
Sir, Alhamdulillah, currently I don't have any symptoms.
Okay. Yeah. So some people would argue that you can wait a little bit longer too. It's up to you. But I generally say once you've recovered from all of the symptoms, you can take the vaccine.
Okay. Even I'm a diabetic patient, I'm okay, right, sir?
Absolutely, absolutely. Diabetic patients should again stand in the front line to take the vaccine. Because if they get COVID, they can get more sick than the normal person.
Lungs ke dark.
Okay. Jazakallah, sir.
Okay. Now, Asima Begum.
Assalamu alaikum.
Wa alaikum assalam.
Actually, doctor, my husband is an arthritis patient, and he takes painkillers like this HCQ 200 and Lefnoten, all those. Like, should he stop taking these tablets 2 days before and not take after 2 days the vaccine?
So the first medicine you said was HCQ, which is hydroxychloroquine, I believe.
Yes.
What is the second medicine you said?
Leflunomide it is. LEF.
Leflunomide. Okay. So these are immunosuppressive agents. So in his case, I would suggest he takes the Covaxin because it's a killed vaccine.
Covaxin.
So, yeah, because the Covaxin is a killed vaccine. So patients who are immunosuppressed, generally we advise them to take the killed vaccine and not any of the live attenuated vaccines.
Okay.
So he can take the killed Covaxin. Yes.
Okay.
It should be okay.
And can we continue taking our daily like BP, hypertension medicines?
Absolutely. Don't stop any of your medicines while you're taking the vaccine. It should be fine.
Actually, we are planning to take it this week. And I also have a problem like a slight abdominal pain, like this fibroids or something. Should I go for it or postpone it?
No, you can take it. Now, if you're having a lot of pain on the day of the vaccine, maybe you can postpone it. But if your pain is chronic, it comes and goes, that's fine. Go ahead.
I'm taking cyclopam for that.
Okay. That should be fine. That's not a problem.
Cyclopam I can take if it's paining?
Yes.
Okay,
I mean, it shouldn't interfere with the vaccine if that's what you're asking.
So my husband shouldn't take Covishield, only Covaxin he should take.
In his case, because he's partly immunosuppressed, that would be my advice. Yes.
Okay. Thank you. Jazakallah.
Okay.
Yes.
Now I request Abdul Mujib Saab to ask his question.
Assalamu alaikum.
Wa alaikum assalam.
So this is Abdul Mujib from Bangalore. In fact, I'd like to check that one of my sister, she's in hospital, Ramaya, due to COVID. She's having severe infection, lung infection, and treatment is going on. Alhamdulillah, I think today it's a little bit improved. I'd like to know what exactly we have to take precaution once she comes back, because you said that there is a lot of complications may occur once after COVID. And now also there may be so many side effects. So once she comes, what we will take the precautions to avoid the things? I'm just recording this.
Yeah, excellent question. Again, we have a talk by Dr. Altaf exactly on this, I mean, life after COVID or post-COVID care. So I believe he'll be addressing this in his talk. So I will defer this question to him.
Yeah,
he's going to having an entire talk on this.
Abdul Mujib Saab, the next session, what we have is on post. The question what you are asking, same topic we will be having next session by Dr. Altaf Sahab. Okay. He will tell us about what could be the complications post COVID and what is the care we have to take. So your question goes to the next session, inshallah.
No problem. Another question was there. In fact, I got already the answer for that. That is about the vaccination when we had to take. Anyway, that's okay.
Okay.
Vaccination for the COVID patients. That already you said that. Now, one more for me. I like to check. I have already taken Covishield. It's now almost 60 days. I tried to take here again the second dose. They refused for that. Is that any other, if it is available other than the Covishield, I can take that? Or no, only Covishield itself, I have to take second dose also? This is my question.
I'm curious to know why they refused it. Why did they say you can't take it?
And because the 84 days, it is required from government order. As per government order, 84 days must cover the first dose. Then only they will give. Actually, earlier it was some 50 days something. Unfortunately, when I went there, just last 2 days before the new orders came up.
I see.
So it's my luck anyway.
Yeah. So the Covishield and Covaxin are two very different vaccines. If you decide to take Covaxin, you will have to start all over again.
Again from first.
Yeah, you'll have to take the first dose and the second dose. I would suggest, you wait for if you can get the second dose of the Covishield after a few days or weeks, I would suggest you do that. Remember, even with one dose, you can get some benefit. The benefit is higher after 2 doses, but even with 1 dose, you do have some protection. The reason we give a second dose is it boosts your protection. In fact, in certain situations, we give a 3rd dose too. Because in some people, we are seeing that some people, even after 2 doses, their immunity doesn't pick up. So to these people, you give a 3rd dose. So the purpose behind the 2nd and 3rd dose is to boost your immunity further. But even with 1 dose, you have some protection. It's not like, you're zero.
Okay, that's good. But the second dose is different than first dose, or it is the same?
It's the same. It's the same. For the particular vaccine, it's the same. A Covishield and Covaxin, of course, are different. So Covishield first dose, Covishield second dose, it's the same. It's boosting the effect of the first dose. Similarly with the Covaxin. Yeah.
Okay. Then now the period, if given the period 84 days, 90 days, something like that, if it exceed, any problem for me?
No.
How long it takes to take second dose? Because in Saudi Arabia, still second dose not yet been.
Yes. So exactly, and this is a very valid question you're asking. So the reason we like to give the 2 doses at the time that is recommended by the company is because that is how they studied it. All right, but there are newer studies showing that if you prolong the duration from year to year, it is still effective. So I would say take the second dose when it is available to you. If you take a little bit longer, that's okay. You will still have protection from the first dose.
Even 6 months, doctor?
Yes.
Even 6 months, doctor?
Yes, even 6 months.
It's okay. Thank you very much.
It's okay. Try to do it within the specified time period. But for whatever reason you have to delay, it's okay. Yeah.
Okay.
But try
Thank
to
you very
get
much.
it. Yeah. Okay.
It's great. My question, come back. Thank you very much. Jazakallah.
Okay.
Next session.
I request Mohammed Arif.
बहुत शुक्रिया। अस्सलाम वालेकुम जी। अस्सलाम वालेकुम डॉक्टर साहब, मेरा सवाल ये है कि जैसे आपने अभी बताया कि वैक्सीन डेड वायरस से बनाई जाती हैं, जो वैक्सीन बनती हैं, तो मेरा सवाल ये है कि जब लाइव वायरस से किसी भी पर्सन का साबका पड़ गया और उसको डिसीज हो गई, कोविड हो गया, और जो लाइव वायरस अंदर गया, तो उससे एंटीबॉडीज वो नहीं बनेंगी जो हमारा डेड वायरस बना रहे हैं? क्या उसके बाद भी वैक्सीन लेना कंपलसरी है?
हाँ, बहुत ही अच्छा सवाल। तो सवाल है, अगर आपको लाइव वायरस से इन्फेक्शन हो जाता है तो आपकी बॉडी में एंटीबॉडी बनती है कि नहीं? बिल्कुल बनती हैं और ये एंटीबॉडीज भी आपको इन्फेक्शन होने से बचाएंगे। लेकिन एक बात जो हमें पता नहीं है वो ये है कि ये एंटीबॉडीज आपके जिस्म में कितने दिनों तक रहेंगी, 1 महीना, 2 महीना, 1 साल, जिंदगी भर, ये हमको पता नहीं। और वैक्सीन से जो एंटीबॉडी बनता है, वैक्सीन एक्चुअली आप ऐसा सोच सकते हैं कि वायरस को कमजोर बनाकर या उसे मार कर दिया जाता है। तो इससे जो एंटीबॉडीज बनती हैं ये ज्यादा सेफ है आपके लिए। लेकिन हाँ, आपको जरूर आपको जरूर इससे भी आपको हिफाजत मिल सकती है। जो अगर आपको नेचुरल इन्फेक्शन हो चुका है और आपकी बॉडी में एंटीबॉडीज है तो मुमकिन है कि यही आपको सही सलामत रखे। मगर आपको ज्यादा महफूज रखना अपने आप को तो वैक्सीन भी लें।
थैंक यू।
ठीक है।
Now, Parvez Pasha. No, Parvez Pasha on priority basis because he's saying his mother-in-law is right now admitted in hospital.
Okay.
Yes, Mr. Parvez Pasha, unmute करके बात करें। अनम्यूट करें, अनम्यूट प्लीज, अनम्यूट योरसेल्फ। We are not able to hear you, Mr. Parvez. Please unmute yourself and talk. Unmute. Yeah.
Already unmute hai
But I don't know. We are not able to hear you. बिल्कुल आपकी आवाज नहीं आ रही है. We can't hear you. Please rectify your device. So we'll come back to you again. So now I request यहाँ पे मोहसिन खान बोल के एक है. मोहसिन खान.
Yes, Assalamu alaikum.
Assalam.
Okay, doctor, I have two questions for you. So one thing is we would like to know that this virus will sustain or will be still alive on non-living surfaces like steel, gates, cars, or bikes, anything. If the viruses will still be active if it is active, will it be for how long it will be active? And second thing, there are studies coming up in India that the third wave will hit the children, the child, kids, and everybody. So all ages will be affected. So especially, how can we protect our kids, and how can we try to, keep our kids safe in case if it is going to be?
Okay, so the first question was, can the virus survive on objects, on inanimate objects? Yes, the virus can. From earlier studies, what I recall, the virus can survive a few hours, maybe even up to a day or so, but not much longer than that. The virus needs a human body for it to survive longer and to replicate. But yes, it can stay on inanimate objects for a little while. The second question is, how can we protect our kids? Now, all of this talk about a third wave affecting children and all, we're not sure about this. This is something that may or may not happen. Allah alam, Allah knows best about what will happen in the future. But if you're asking how we can protect our children, it's through vaccination. The more people get vaccinated, the virus will just go away from your community. And we are seeing this in many countries. As 60, 70, 80% of the population is being vaccinated, the virus just cannot survive. And we may not even have a third wave if enough people get vaccinated before the third wave starts. If you get vaccinated, you will not get the infection. If you don't get the infection, you will not give it to your kids. And of course, as the vaccine becomes more widely available, they will also start offering it to your children. And at that point in time, I would suggest you take it and give it to your kids. As soon as the vaccine was available in UAE to children, I gave it to my kids. And that is what I would suggest all of you also do. Do not be afraid of the side effects of vaccines. Vaccines are safe.
Yeah, we can spend some more, just 10 minutes on question answer session because we are getting late. We have to move on to the second session as well. So now I request iPhone. It is written iPhone. I can see from long time. iPhone.
I think this is, it probably is me.
Yeah, that's your
Hamid,
yeah.
Hamid, this is Rashid here.
Yes.
So, quick question for you. So, we recently had an incident, and you're aware of it, where we had a doctor who got vaccinated, Pfizer 1 and 2, went to India to meet a family member, contracted COVID, and passed away. What are your thoughts around that?
Okay. This is exceedingly rare, but yes, it can happen. This is very, very rare, though, when someone who has taken the vaccine, and especially taken 2 doses of the vaccine, still contracts the virus. But can it happen? Yes, absolutely. Anything can happen. There's always a 1 in a million chance that you could just walk on the street and get into a car accident while just crossing the road. But having said that, I will also say that I have seen thousands of patients, or rather, I know about thousands of patients who have had the vaccines, and not one of them that I personally know of has contracted a serious case of COVID.
Okay, so for the benefit,
this is very rare. So yes, it can happen. I don't deny that something like this happened. In fact, I do know a couple of cases of patients who were fully vaccinated but still got COVID, and their symptoms were moderate. They're not severe. They survived. They got better. And one of them was actually an old person that we were all worried about, but he also survived. almost all the cases that I have seen of patients who have the COVID after the vaccine have survived. But can someone die? Yes, they can. But this is going to be very, very rare.
Just one more follow-up. So for the benefit of this audience, the percentage of this happening and the likelihood is what?
Okay, very, very good question. So, all right. Let me share with you some data from the CDC. CDC is Centers for Disease Control in America. So in the US, it is mandatory to report any death that happens after vaccination. COVID vaccination I'm talking about. So just to clarify this, so say someone got the COVID vaccine and then had a car accident and died, you're required to report it. This is mandatory in the US. And in the US, unlike in India, when you say mandatory, it is mandatory. People report it, otherwise they get into trouble, they can get fines, they can even have their licenses taken away. So people take this very seriously. So what the CDC did was they started collecting data on all of these deaths. After the first 200 million shots of vaccine had been given in the US, 200 million, 20 crore, this is not a small number. After 200 million shots had been given, they sat down and analyzed the data. They looked at all of the deaths that were reported, and across the US, 3,500 deaths were reported after the vaccine. Okay, 3,500 people. So 3,500 people had died after getting the vaccine within a few days. Now the CDC set up a committee to investigate these deaths and find out if these were related to the vaccine or not. And the conclusion of this investigative panel was not a single death could be attributed to have happened directly from the vaccine. So just to give you an idea, deaths after vaccines are very rare. Can they happen? Yes, they can happen. But most of the time, they're not related to the vaccine, they're related to something else.
Yeah, that's what. Until and unless we investigate and what was the cause of death, we should not brand that he died because of vaccine. This is very, very important.
Yes.
Even if he had not taken vaccine, maybe he would have died at the same time because of that particular disease.
Yeah.
This is very
Again,
important.
I want to put the numbers in perspective. 200 million versus 3,500 deaths. This is a very, very small number. If 200 million people had contracted the virus, about 2 to 4 million people would have died by then, because that is the case fatality rate of COVID. About 1 to 2% of people who contract COVID die from it. All right, go ahead.
And there is, yeah, and there is a wide misconception over here because of a direct correlation of taking the vaccine and the death that happened immediately following it, and it had to be addressed. And just one last thing is, what about, I've got a bunch of friends that have been vaccinated and they've still contracted COVID, but the symptoms are slightly milder than when they had it prior to the vaccines. What do you recommend? I mean, they're still contagious, I'm assuming?
Yes, they are. So this is this happened to my own wife, and this happened to some of my cousins over here too. They are absolutely contagious. They still have COVID. And this is where the vaccine comes in. The vaccine may not prevent you from getting COVID, but because you already have antibodies built in, it will help you fight it off quicker. And most of these patients who contract COVID after the vaccine have mild symptoms for a short duration of time. So they have to take the usual precautions like anybody with COVID would take. Yeah, but most of these guys recover quicker, and they still have to self-quarantine, stay away from people till all of the symptoms are completely gone away.
Okay, Dr. Saab,
thank you.
Is there any other question?
I'm good, thank you.
Okay. Yeah, there is one question from Mr. Tajuddin from USA. He's watching us on YouTube, so he has sent me the message. His question is, the vaccine chemical compound extraction is from cow or pig fetus?
Okay, good. So good question. I want to talk about two things over here. Number one, as Muslims, we all are always worried about haram and halal and what the vaccine components are. So to this effect, I want to say the UAE, with the country which I live in, United Arab Emirates, the UAE Fatwa Council issued a fatwa at the end of 2020 stating that all COVID vaccines, at this point in time, the COVID vaccines were just starting to come into mainstream. They stated that any COVID vaccine should be considered a medicine, and even if it contains small parts of something that is normally considered haram, the vaccine is permissible, because in medicine, as we know, small parts of haram things are also permissible. Having said that, I'm also going to tell you that both Covishield and Covaxin, the two vaccines available in India, are vegetarian vaccines. They have no pork or bovine products. This has been confirmed. I even checked with the manufacturers on this, and this we know for sure.
Okay, now I request Mrs. Ruhi Amir.
Assalamu alaikum. Yeah, first of all, I would like to convey my deepest gratitude to all the dignitaries here who have been so very concerned as to hold this meeting to answer all of our doubts and queries. Being in here in this meeting, I wish to ask two of my important queries, which are really very important for myself and my family. First of all, I'm a 40 plus female, okay, and I'm very sensitive to the most mildest of the drugs like Crocin or Calpol. So I just want to ask if I would be okay with the vaccine, because my body acts very crazy if I adapt to any kind of medicine which is new to me, apart from the paracetamols or maybe one or two mildest Brufens. So is it okay if I take a vaccine at this point of time, wherein I have a phobia as well as a stigma attached with so many contradictory kind of informations lying around? So would it be all right if I take this vaccine?
Have you taken any other vaccines in the past? Have you taken the flu vaccine, for example, or tetanus shots and other vaccines?
Yes, tetanus, of course, during
flu
my pregnancy.
Vaccine? What about the flu vaccine? Have you taken the flu
Not
vaccine?
Not
okay.
at all.
Have you taken any other vaccines?
Not at all, except the BCG long ago.
Okay. I mean, everybody is different. So, this person reacts differently to different medicines. So I cannot predict what will happen to you. But having said that, I'm going to say a kill vaccine is considered very safe, even in patients who are immunosuppressed, even patients who are getting chemotherapy or cancer, we give kill vaccine. And the kill vaccine available in India right now is the Covaxin. If you do get some side effects, it's basically your immune system working to make antibodies. You should not get any serious side effects from a kill vaccine such as Covaxin. So I would recommend you go ahead and at least try the Covaxin, if not the Covishield. The Covishield is designed from a live virus, but a non-pathogenic virus, which normally does not cause any disease in people. But if you really wanted to have the safest of the safe, then it should probably be a kill vaccine, which should be, in your case, Covaxin.
Okay, now I'll ask, we can allow only another 2 members, that's all.
Assalamualaikum. Parvez here, sir.
Parvez bhai, boliye, we are able to hear you. Yeah, please.
Yeah, Assalamualaikum, sir. My name is Parvez. My mother-in-law, she is admitted, she's about 8 years old. She has been admitted due to she cannot breathe properly, and it was very heavy for her. So when we took to hospital, the beds were not available. Finally, we got it in the government hospital, and she was feeling very, very heavy, and she was not able to breathe. So gave the oxygen. Her saturation was very good. Was okay. Hello.
Hello? Please go ahead.
Yeah. Now doctor says her lungs is damaged, and she is feeling very uncomfortable to take the oxygen.
Oh, again, please unmute yourself again.
Yeah, the oxygen, they gave the oxygen. Now but she is feeling very uncomfortable to take the oxygen, and she is removing the the mask. Because she don't want it, and she is actually she was very good quality earlier, very good health and very responsive and respectful. Now she is acting a bit wild, and she want to throw away and she want to go out. She acts like this. So I want some advice regarding this, and now she is having again the breathing problem. It's a bit serious.
Yeah. Well, first of all, I'm sorry that your mother-in-law is in the hospital. What you're describing sounds like delirium, Sounds like she's getting delirious in the ICU. And when people are delirious, they are often confused. They don't know what they're doing. And they often fight you when you try to help them. Only a physician at the bedside can decide what type of treatment can be beneficial. We do have some medicines which can help calm
we have very good medicines suggested by doctor, and our own pharmacist is there. Problem here is when we talk to doctors and other consultants, they said that she cannot be in ICU because of some negative reasons, I think. So that's why she's been kept in with oxygen. And now they are given other treatment, the alternative to oxygen. And she is able to breathe, but she's still having the same problem continuously.
Yeah. So, I really cannot tell you what the best thing is without actually seeing her, examining her, which is not possible via a Zoom meeting. Only a physician at the bedside can decide what the best medicine for someone like this can be. This can be a challenging case, but there are medicines that can help in calming her down. And as long as her oxygen saturations are low, she needs the oxygen. If she starts removing the oxygen and does not put it back on, her condition could get very serious.
Yeah. What is the reason that she want to remove the oxygen and want to throw
this
away?
This is because of delirium. So the delirium is something very common that, especially with older patients, we see that when they are hospitalized. This happened to my own mother. This happens very commonly. And this is also related to how sick you are. Once your illness starts to improve, this will go away. The confusion.
Actually, she was not having any problem earlier. No problem at all. Because she developed some mild tabet kharab thi, so she took medicine without having food. That was the reason. And after a few days, she had problem in the lungs, and she went to the doctor. But now that's what this is the serious problem, that she don't want to take the oxygen. That's the reason.
Yeah. Okay. Again, I'm sorry. Without actually seeing.
Actually, she is not in Bangalore. She is not in Bangalore to admit in ICU. She is out of Bangalore in Chikmagalur. Actually, she is there. We have only 3 hospitals there, and that was the reason we couldn't take her to ICU and not even to Hassan, because there were no ICU beds. Bangalore I could arrange, but it is very risky to go from there.
Okay, yeah.
Anyway, thank you, sir. Thank you so much.
I will. Assalamu alaikum, doctor. I have a very quick question, if you don't mind.
I now only 2 more. One is Zafar Umar Sahab and Mohammed Ansar. These are the 2 people. Then we'll stop this question. Zafar Umar.
I have a very small question, if you don't mind.
Okay, please ask.
Okay. Yeah, my father is 47 years. He has a history of valvular heart disease, and he has been treated for diabetes as well as hypertension. I would like to know if it's safe for him to take the vaccine regarding the Covishield or Covaxin. And also he's on the medication Telma H, Ecosprin 75, Rose Day, Oxtra, Metformin 500 mg. So if you would please tell me whether is it safe for him to take the Covaxin or Covishield.
Okay. First of all, I have to say I don't practice in India, so I'm not familiar with all of these drugs you have mentioned, because these drugs are all company names. But in general, both the conditions you mentioned, the heart disease, the valvular heart disease, the diabetes, none of these are contraindications for the vaccine. So yes, he can take the vaccine. He can take either one that is available to him, either Covaxin or Covishield. It is absolutely fine.
He's taking aspirin 75.
Aspirin, I understand, but many of them.
And metformin.
Metformin also, I know.
Dapagliflozin.
Okay, that's a diabetic medicine. That's also fine. No, should not be a problem.
He's a patient for this as well, hypertension.
Okay.
And he's taking telmisartan.
That's fine. That's okay.
And another is 2 minutes. Let me just check. He's taking rosuvastatin.
Rosuvastatin, that's fine. That's fine. Yeah. That's a statin. No problems. None of these medicines, there's any problem.
Okay, so he can continue taking even before and after the vaccine?
Absolutely. Act as if nothing has changed. Continue taking all of these medicines while he gets a vaccine.
So he can take either Covishield or Covaxin?
Yes.
Okay.
Okay, now
Thank you.
I'll I request Zafar Omar to ask his question.
Assalamu alaikum warahmatullahi wabarakatuh.
Walaikum salam.
Dr. Sohail Saab and Dr. Hamid Saab for this wonderful thing, which has been put up. I just have two quick questions. I don't know. So what is the difference between the first dose and the second dose? And I have already taken my first dose, that is on my left hand. And why is that I need to go on the right and why not on the same arm?
Good question. To be honest, I'm not familiar why you have to take it on a different arm. I took mine on both of them on the same arm. But there really isn't any difference between the first dose and second dose for most of the vaccines. Some I know in some of the vaccines, what they do is they change the dose for number 1 versus number 2. They give you a slightly higher dose for the second time around because that has been found to be more effective. And in some of the vaccines not available in India, I know they have changed the vector from one to the other. But the vaccines in India, from what I understand, the dosing, both the doses are exactly the same, both Covaxin and Covishield. So I don't know why you're being told to take it on a different arm. I'm not sure.
This was since I live in Saudi Arabia at the moment.
Which vaccine were you offered? Which was the vaccine?
I went for Pfizer, Dr. Hamid.
For Pfizer?
Pfizer.
Okay. Pfizer. Okay. No, yeah.
Once you get into the vaccine center, they did ask me whether do you want it on the left arm or the right arm. So I just told them, give me it on the left. So the next they will be going me for the right. So there's this concern, like what difference does it make? Anyways, thank you very much.
I'm not familiar with any difference in either one. I think you should take it to the same arm if you want. To be honest, I don't know why they're asking you to do that.
Okay, I request Mohammed Ansar to
Assalamualaikum, Dr. Thank you very much for your wonderful explanation and lecture. I have smart 4 questions. The first question is, do you have any absolute contraindication for the vaccine? And second question is, after 2 doses of vaccine, do you suggest to take the booster dose after a year or 1.5 years, like that? Anything there's any study? And third question, when do you recommend to start the steroid? Do you have the patient to start immediately if the symptoms started, or when the patient has started developing hypoxia, that time you do suggest? Or fourth one is, after the 2 doses of COVID vaccine, you remember in India, Dr. Agarwal, IMA president, he died of COVID complication of COVID. How will you explain this, please?
Okay, I mean, that's a lot of questions. I'll try to remember. I'll try to answer them as best as I can.
The first question is absolute contraindication for vaccine to receive.
Yeah, so that's a very good question. So as you may know, these are all new vaccines. Whenever there's a new vaccine, they first test them on healthy subjects. They exclude many people who they feel might suffer if there are any major side effects. So, people who are getting cancer treatment, people who are, women who are pregnant and young children, these are all populations that are excluded. So when the vaccines first came out, they told us not to use a vaccine on these people only because they had not tested them. Okay. Now, as more and more people have started taking the vaccine, they found out that some women actually who did not know that they were pregnant took the vaccine. And when they followed these women, about 28 or 29 of these women, they found that all of them did okay. There were no problems. So now many vaccine companies are saying it's okay to give it to pregnant women. Similarly, for children also, now more and more vaccine manufacturers, as the experience goes, they're saying it's okay to give it to children. As far as immunocompromised patients are concerned, someone who is taking cancer chemotherapy or who is actively immune suppressed, from what we know from our traditional vaccines, I would say a kill vaccine should be okay even in those patients. We do not have data about live vaccines on these patients, so I'm going to say we don't know. I'm not going to say it's harmful. I'm going to say we don't know. Now, your second question was, I think, about when should I get a booster after 1 year or so? The answer to that is, I don't know. I'm not saying it is harmful. I'm not saying it is useful. I'm saying I don't know because that is the right answer. We don't know whether you will need a booster or not. Maybe you will, maybe we won't. Only time will tell. What was the other question?
When to start steroid earliest?
Yes, so that's a very good point. And I'm happy you brought this up because I'm seeing a lot of indiscriminate use of steroids in many people. Even doctors, I'm sorry to say, some doctors I've seen prescribe the steroids when it is not indicated. Steroids can be harmful if used inappropriately during COVID. Steroids are only indicated if you are hypoxic. That means most of the time you are in the hospital. You cannot have someone who is hypoxic at home, unless they have oxygen supply, of course, and then be a steroid. So if you are not having hypoxia, do not take steroids. They can actually cause more harm. There is some concern that some of the complications we are seeing after COVID, such as mucormycosis, may be being caused by indiscriminate wide use of steroids everywhere. So I should not advise steroids unless you are hypoxic. And let the doctor decide. Please don't decide on your own.
Okay. The fourth question is, after 2 doses of vaccine, Dr. Agarwal, IMA president, he died of COVID and his complication. How to explain that? So after having 2 doses of complete vaccination, he died because of COVID.
Do you know which vaccine he took?
I don't remember, but India.
All right. Okay, no problem. That's okay. That's okay. The reason I asked that is, I myself know of some cases, like one of my close friends actually, who took 2 doses of the vaccine, and after the second dose, he checked his antibody level, and the antibody level was 0. So some people, despite taking the vaccine, for some reason, their immune system does not produce antibodies, and they are not protected. So everybody's body is different. So you can have rare cases where, your immune system just doesn't work and doesn't make the antibodies, and you don't have the protection that you think you had from the vaccine. And these people obviously are going to be susceptible to getting COVID and even having bad complications from COVID. Without investigating Dr. Agarwal's case, I cannot say what happened, but it is possible that despite the vaccine, he was not protected.
Yes. Okay, thank you very much, sir. Thank you very much.
Last question for this session from Dr. Atiya, because she's requesting that she has some important question to ask. But this is last for this session. We'll move on to next session. Dr. Atiya, please.
Hello, Assalamu alaikum, doctor. Doctor, my question was, as we know that if we contract COVID, we can contract COVID after vaccination also. But what is the virulent factor? Like, how can it? At what rate can it infect others? Is it at the same rate, or like it's going to be milder, doctor?
So,
or like fewer people?
Okay, I'm guessing your question is, say I took the vaccine and then I got COVID. Will I pass it on to others? Is that what you're asking?
Doctor. Yes, sir. At what rate?
Yes. I don't think anybody has studied this. At least I'm not aware of any studies looking at this. I would assume that the rate would be the same as someone who gets COVID. And so you should still practice precautions such as isolating yourself till your symptoms have completely resolved.
Okay, doctor. Thank you, doctor.
So I would not assume that, just because you got the vaccine, you're not going to get a severe infection and you're not going to pass it on to other people. You can still pass it on to other people.
Fine, doctor. Thank you, doctor. Thank you so much. Jazakallah.
Thank you.
We regret for the people whom we are not able to, allow for questions further, because we are running short of time. We have another session as well. So I thank everybody for participating in this session. Now I request our Dr. Altaf Sahab, we will go to our next session. That is, as many people were inquiring, were eager to know about certain complications and what should be the post-COVID care. So this is our topic for next session, which will be, our Dr. Altaf Sahab will be giving on it. Dr. Altaf Ahmed Sahab, as of now, he is the medical director for Shifa Hospital in Bangalore. He's basically, he did his medical graduation from Bangalore Medical College. Then from Davangere, he did his Master MD in General Medicine, and he was a gold medalist. And he cleared MRCP in first attempt. This is something to be proud of. Alhamdulillah. And and I can say he's a beloved one. I request Dr. Altaf Sahab to start off with this second session, that is complications and post-COVID care.
Jazakallah, Suhail bhai, can you actually share the screen with me?
Yeah, sure.
Yeah, enable it for me.
Yeah, I have given Dr. Saab. Are you able to?
That's fine. Yeah.
Okay. Please go ahead.
Jazakallah, Suhail Bhai, Dr. Salim Bhai, and mashallah, all the members of BENFA for giving me an opportunity. Bismillahir Rahmanir Rahim, Alhamdulillahi Rabbil Alameen. سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم سبحانك لا فهم لنا إلا ما فهمتنا إنك أنت الجواد الكريم اللهم ربي زدني علما اللهم ربي زدني علما اللهم ربي زدني علما ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. At the very outset, actually, I am really pleased to hear Dr. Hamid, inshallah, generated a lot of questions. It was very interactive. And naturally, especially in today's scenario, it was apt. And people they had their own doubts, and it was cleared by Dr. Hamid, mashallah. Very impressive it was. Jazakallah, Hamid. Right. So now, a difficult topic indeed, post-COVID complications and management. Yeah. It is hit and run effect. Disease is infective in first week, creates a lot of inflammation in second week. In some people, it becomes hyperinflammatory and this goes on for about 2 to 3 weeks. And it lingers in, unfortunately, 10% post third or fourth week. Top of any organ, it can affect. Whether it is brain, lungs, liver, gut, muscle, eyes, nose, heart, kidneys, blood vessels. And invariably, it is nothing but inflammation-related cytokines and a lot of autoantibody production that I will not get into that in details. It is actually, unfortunately, we are letting loose a vehicle without brakes on the road. And ultimately, a lot of things happen acutely. When we are going to say it is actually post-acute COVID, because as Suhail Bhai was trying to tell us, there's a lot of literature and people have gone through that and ultimately they know a lot about COVID per se. But when you call actually this as post-COVID, there are some symptoms, actually syndromes that are defined as post-acute COVID-19 syndrome, and there something called chronic, yeah. And the definition is still evolving, you know. The only thing you remember, in case if there are persistence of symptoms right from day one, patient continues to be symptomatic, it is for more than 4 weeks. Our patient had become asymptomatic, he was absolutely fine, and he develops actually new symptoms or sequelae after 4 weeks. 3 to 4 weeks is the time because still they're not very sure, but take it for granted, actually it is 4 weeks time. It's acute up to 4 weeks. And it is 4 to 12 weeks, it is post-acute, and then it is going to become chronic after 3 months. This you need to remember. But either it is persistence of symptoms, or it is development of sequelae, when the patient had become asymptomatic, and they become symptomatic after 4 weeks from the start of the disease process. This I need not, actually, this is a slide which possibly I'm sharing with you. Yeah, and basically remember, it is first 4 weeks is acute, subacute or ongoing COVID actually when the disease process is more than 4 weeks to 12 weeks and beyond 12 weeks to 6 months, it is either called as post-COVID-19 or chronic COVID-19. I'll just actually briefly tell you, because the main, unfortunately, organ that is affected in COVID, we know is lung. Yeah. And that has caught the attention of everybody and anybody. Oxygen. Yeah. This is where. So basically the wide spectrum of pulmonary manifestation, but where what breathlessness. Where the patient is and he is either oxygen dependent chronically, or he is not oxygen dependent chronically. And sometime in the hospital too, there are patients where they are on an IVs, non-invasive ventilation. In fact, especially in second wave, we've learned from the first wave, we don't ventilate patients with COVID very often nowadays. Yeah. And usually out of 10, only 1 or 2 they come out. Very difficult yeah. But there are some patients, I keep telling in case if HIV fails, somebody can unmute, I'll be grateful. Sorry, mute actually the phone, swell by. Yeah. I'm sorry about it.
Mute kar de.
Please, I'll mute everybody inshallah.
Okay, so I was trying to tell you, there are patients, in case if there's a failure of non-invasive ventilator, it's a death warrant for the patient. So we have patients who are on actually prolonged NIV and they develop fibrotic lung damage, and this has been reported among COVID-19 actually survivors. It is almost typical to what actually we see in other ARDS. But remember, actually, out of 100 patients, the mortality is about 1 to 2%. About 10% of the patients who are developed COVID, they can go in for either post-acute or chronic, actually COVID, or what we call, as I told you, more than 3 months to 6 months. Some symptoms related to some organ system. It could be multi-organ or otherwise. So usually, remember, about more than 50% they actually develop, especially this, when they develop dyspnea, they are symptomatic in that 10%. And often, actually, whether you do a HRCT, very often we get what is called as post-COVID lung fibrosis. This is one picture I have actually shared with you. There are many like this. Now, I'm going to just really brief the problem. I'm not going to brief actually the management detailing, just how to go about in a given scenario when we are going to have actually a patient with dyspnea at home. Home pulse oximetry is going to be very helpful here. And especially how to go about is, don't actually rush to investigate the patient. Yeah, basically clinical assessment and chest X-ray in all the patient, especially in case the symptomatic, at the end of 12 weeks. And normally a good actually attitude is to go in for, in case if they are actually symptomatic and clinically you feel the patient has actually symptoms and signs. In addition to that, X-ray actually has worsened or new actually lesions have appeared. There are some patches. It is the right time to actually, what normally we do is what is called a 6-minute walking test. This is very, very helpful. See the saturation beforehand. We make the patient to have a normal walk for 6 minutes and see the saturation. If it falls, this actually, if it's going to remain status quo and inshallah just fine, patients improved, and usually they do improve in graded fashion, and it is going to take time. So basically, in case if it falls, the right time to do pulmonary function test and see if there's any secondary infection, do sputum sampling and see whether there is any unmasking of actually tuberculosis, which is not uncommon in India. And of course, ongoing and worsening shortness of breath is an indication to actually evaluate the cardiovascular system, because the inflammation is ongoing, especially in the myocardium. Inflammation can linger for more than few weeks to months, and especially people are very prone to what is called as stress cardiomyopathy. In such cases, actually, possibly though there are actually reasons, we should not use RAS actually inhibitors, but still they are helpful in these given cases. Depending upon the assessment, what we do at the end of 12 months, in case if there are actually changes in this given scenario in the reports, those are the patients we need to go for HRCT of the chest or go for actually CT, pulmonary angiogram and echocardiogram to really pick up cases was going to worsen with passage of time, how to go about. Their management totally differs. In case otherwise, actually just let them come for a follow-up. But remember, it is not actually wise to leave the patient at the mercy of investigation and assessment for 12 weeks. Possibly it is wise to call them. Normally what we do here is we call them after 2 weeks. And again, in case if they are symptomatic, we call them 4 to 6 weeks after discharge. Especially remember 4 weeks and 4 set of patients. Yeah, and try to actually evaluate 4 things. This is very easy to remember. 4 weeks after discharge, 2, 4 actually set of patients who had severe pneumonia. Yeah. By this, I mean 2/3 or 75% of both the lungs were involved at the time of admission, and the patient was admitted, and then he was discharged when he improved. And patients who were requiring ICU care, and they were actually on BiPAP, or they were actually on an IV, requiring ICU care. These are the people. 2, elderly, of course, and 3, especially multiple comorbidities. These 4 set of patients, we need to carefully assess, and assess what? 4 things we need to do. 1, of course, as I told you, is respiratory system. It holds the priority. This is where we need to do that 6 minutes walk-in test if it is possible. Yeah. PFT, and as I told you, depending upon the results, yeah, after assessment, go in for, if necessary, HRCT, or actually go in for pulmonary computed tomography of actually pulmonary arteries. And here, what is going to happen is, this is a lot of confusion reigning. First week is infection, and second week, of course, actually is inflammation. Third week is hyperinflammation, and now actually things are changing. All they say is there's no pneumonia at all. It is essentially nothing but actually thrombosis. Basically, the whole endothelium, it gets disturbed. Ultimately, it becomes a source of thrombosis and thromboembolism. So 4 things we need to actually work on. First is respiratory system. Secondly, actually see if there is any thromboembolic sequelae. And 3, of course, where we lose out, that I'm going to bring in last few slides, is neuropsychiatric manifestations, aches and pains, myalgias, migraines, yeah, a lot of actually symptoms, anxiety, actually depression. This, unfortunately, this is because of other than reasons which we don't really address. Basically, underlying depression plays a major role, and that can potentiate and worsen the symptomatology the patient already has, and a lot of actually psychosomatic symptoms are added to what all the patient has, so ultimately making the life miserable for the patient and the attenders. And of course, in addition to this, actually basically whether we have attended to the rehabilitation of the patient. Normally, once we discharge the patient, हम समझते हैं कि काम पूरा हो गया. हालांकि it starts at home. I keep telling to my patients when they go home, आँखें भर को सोना, पेट भर को खाना, जी भर को चलना, and all to be done in graded fashion. It has to start with, mashallah, step 1. It is basically, mashallah, if it's 65, I say we are sending not 65 years old. Actually, mashallah, dad to your house, 6 plus 5, it is 11-year-old. Actually, mashallah, kya hai? Wounded child to your home. So invariably, we need to attend as we attend a wounded child at home. That we need to remember. 70 is not 70, he's 7 plus 0. Is 7 saal ka dakhmi bachcha going home. So basically with this, so we need to really prepare, especially the household members, especially and sit with them, counsel them, and have actually a meeting with them in person, or mashallah, whatever on conference call. Try to actually explain to them these 4 things you can assess in actually at the end of 4 weeks, and especially in this 4 group of subset of patients. Possibly we can actually prevent a lot of chronic symptoms that these people suffer, especially related to pulmonary system. Of course, treatment, we don't have anything special. Corticosteroids are definitely beneficial, especially because inflammatory lung disease is what we blame. Though actually corticosteroids should not be used in first week, where it is infective, where the other drugs are going to be helpful, trying to actually prevent the replication of virus. But in second week and third week, or where it lingers, inflammation, corticosteroids still they have a role to play. But we need to be careful. It should be judicious use. It should not be indiscriminate use of steroids. That we need to remember. People are trying to do lung transplantation. It's a far-fetched actually thing for a scenario like ours in India. Well, still actually there was possibly one done in Apollo actually, and things so in Chennai. I don't remember the others. Of course, pulmonary fibrosis, there are a lot of drugs and a lot of homework is going on regarding anti-fibrotic therapies, and great fashion they increase the dosages. But actually, in case if you keep on increasing dosages, we need to remember they're going to affect actually liver altered LFT, altered actually is going to be a rule. So we need to go midway rather than trying to indiscriminately keep on increasing the dose of anti-fibrotic therapy. One thing I always keep telling, see, there is something is called as actually metabolic pool in the body. All the drugs once we introduced in the body, they go through this metabolic pool, they get metabolized. Ultimately, useful substances are used up by the body. The substances which are not useful, they are thrown out by kidney, liver, skin, etc., etc. But this metabolic pool, it gets basically saturated with drugs. And especially nowadays, in the days of polypharmacy, and this is unfortunately for every organ, there is a drug and there is a specialist. So basically, this is again a passing mention to all our august audience and members here. A lot of them are doctors here. I keep telling 65, 3 drugs, 72 drugs, after 71 drug. And in case if somebody is treating a patient with 80 with drugs, treat the doctor who is treating the patient. Basically, for simple reason why I'm telling this is, remember this metabolic pool is going to get saturated with actually 1 or 2 or 3 drugs. Ultimately, in case if more is given to the body, they bypass this metabolic pool, they don't get actually metabolized, and ultimately directly they are given raw to the body, and they cause more side effects than actually possibly good effects. And a lesson we have learned in Satoskar in pharmacology, as a medical student, I do remember the first sentence we used to learn is a drug without side effect is potentially useless. So this we need to remember, and especially with passing age, actually what happens is this homeostasis, it is going to become homeostenosis. So this is why, especially all these drugs, be careful when we use. Possibly other than drugs, especially what should help, especially is good physiotherapy. Yeah, good actually physiotherapy. Actually, mashallah, exercises, breathing exercises, that in case, mashallah, and routinely asking the patient to be ambulant. Yeah, that normally we don't do. If this is actually good nutrition, and ultimately that is going to help the patient more than I keep telling now, especially to patient and attenders, it is not oxygen plus nutrition, it is nutrition plus minus oxygen whenever we are dealing a patient who is post-COVID. Slide. Regarding actually that, there are a lot many things related to respiratory system, but I'm just briefing so that actually I have to finish this in a given stipulated time. Basically, this was, unfortunately, they said it is less than 5%, which is not the case. Thromboembolic events are definitely more. Actually, this because previously retrospective data was basically it was limited because of small sample size. Definitely, there's a lot of hyperinflammation and inflammation that is lingering, and the duration and severity we don't know in the body. It involves the whole of the vascular system, so especially related to lungs and then the GI tract, lower GI tract. These two areas are more with COVID. So normally we do see this patient coming to us with actually loose motions, actually as a presentation also. So basically these receptors are more in lungs and ultimately and is not able to differentiate. That I'm not going to go into details. But remember, thrombotic events, anyway, the whole area is unfortunately rough, and that becomes a place for clumping of platelets and thrombotic events to start with, and ultimately a series of events and cascade taking place, leading to thrombotic complications. So what normally remember, nothing needs to be done. Don't worry about it. Normally a tendency is once the patient is hospitalized, we do give them low molecular weight heparin, and when they get discharged, depending upon actually the patient's D-dimer, if it is very high, we go for a larger dose, a bigger dose. Actually nowadays we have actually anticoagulants, which we need not monitor INR, and we need not monitor prothrombin time or actually PTT, APTT and INR, without which we can like dabigatran, normally that what I use. In case if it is borderline D-dimer or it is actually a less normal D-dimer, we put them just on the 75 milligrams of dabigatran, and that we normally put it for 6 weeks. Yeah, because this can linger, especially inflammation, duration, severity, we don't know. And in case if there is actually, other than that, there is provoked what we call image confirmed in case if the patient has actually thromboembolic episode related to lung, or there is one term which I'm not going to elaborate, what is called as provoked actually thromboembolic event related to lung. Normally we continue actually anticoagulants for 3 to 6 months. A lot is being spoken of about aspirin as an alternative. It is not an alternative to actually anticoagulants. Possibly it can complement or supplement actually as with actually anticoagulants, a small dose of aspirin, but still is investigated as prolonged primary prophylaxis in the management as outpatients. But remember, I keep telling home quarantine after discharge is only for 7 days, 7 days, 7 days. Let them mingle with people. Disease, once it crosses after the onset of symptoms for 10 days, it is not infective. Even if the patient is positive, it does not spread to others. Basically, let them be physically active and ambulate. And this is very, very appropriate, especially so that the patient don't develop thromboembolic complications, especially if they have comorbid conditions. This is a very common problem which we feel the patient gets, especially cardiovascular sequelae. All the time they complain, especially of chest pain, palpitations. As I told you, there's ongoing myocardial inflammation, and the rate could be about more than 50 to 60%, and it can be for more than 2 to 3 months. And that we can pick up with cardiac MRI, and stress cardiomyopathy has been noted, and we need to de-stress this patient, especially post-COVID. And that de-stressing I'm going to bring to you in another few slides. And basically that's the cause for actually chest pain and palpitations. And especially in case if it is ongoing, persistent cardiac symptoms are there, so this is where we need to actually do a serial clinical and imaging evaluation with ECG and echocardiogram. And as I told you, there are reasons where we claim the patient has increased level of ACE2 can lead to COVID-19, but leave it to the so-called subspecialists in those areas. But definitely it is being proven RAS inhibitors are definitely safe and need to continue in this patient with stable cardiovascular disease. Only thing is, we know actually in the patient is having atrial fibrillation and arrhythmias because secondary to COVID with comorbid conditions is not uncommon. Differ using amiodarone because it is going to cause pulmonary fibrosis. Possibly other than this, we can use other drugs. Now where we lose a track and where we are not interested, unfortunately, is neuropsychiatric sequelae. They are actually, unfortunately, they suffer. Always, actually, हाथ पर ऐसा है कि भी वो है मेरे कब्जे में नहीं, all the time aches and pains. They are withdrawn all the time. They never get a good sleep. They never sleep at all. And migraine worsens after refractory to traditional analgesics which they used to take. And especially late onset headaches are common. And drugs are going to add to us, actually, unfortunately, acid peptic disease, which often presents as headache in this patient, and they continue to take painkillers to worsen their acidity. And one more thing which normally we see, especially what we call as brain fog, completely, my mind goes blank. I cannot concentrate. I have recent memory loss. I don't know what people are speaking. I cannot execute actually what the task I take up. And we actually, ultimately, we brush aside the symptoms when they come to us with cognitive impairment. This we need to actually address. There are a lot of fluctuations. They go on for weeks to months, especially in these patients. And this is actually related to, I'm going to come in another few slides, where as possibly BENFA and all others, each one of us can address this actually area, possibly in case we can cause effect. We can address the causes related to this. Ultimately, a big actually benefit can go to these poor patients who are unfortunately they suffer for weeks to months to years. Yes, of course, very few people, but weeks to months is very, very common. But there are actually only a subset of patients, similar to any other critical illness, especially complications related to COVID-19. It's thromboembolic. They can have ischemic events. They can have hemorrhagic events. They can have actually anoxic damage. They can have breast syndrome. They can have actually a typical feature actually resembling multiple sclerosis. ultimately, well, these patients, unfortunately, they end up, unfortunately, with permanent neurological deficit, and especially they need to have extensive rehabilitation for weeks to months. There are a subset of patients, unfortunately, poor patients who are going to end up with ischemic and hemorrhagic stroke, especially those who are not on anticoagulants, especially in the initial phase of disease. So of course, actually what we need to do, there is a standard screening tools, but here, possibly the right time I feel to bring to the notice of this August gathering. Remember, we do refer this actually cases to the specialist. Ultimately, more and more drugs they get added, and they try to induce sleep. They give drugs for anxiety, for depression, for sleeping disturbance, for fatigue, for whatnot. Every symptom has a drug, and ultimately that's not the answer. Basically, try to address. He is back home, locked down, no job, jobless, and there's a big family to attend to, no food, and no source of income. And already what actually savings he had, actually the fat pay that hospitals have demanded, that already he has paid to the hospital, and that was not enough. Hospitals were not happy. He had to take loan, and ultimately for that also actually what he did, he has actually taken loans and ultimately paid that. So goes on and on. And this is an area where we don't have time. I keep telling actually more than it is not medical actually care. We need to remember it is health care. Unfortunately, we have equated health care with medical care. And definition of actually health is not actually just mere absence of disease process. It is basically, it is actually, we need to give them mental well-being, physical well-being, and third is spiritual well-being. This they have added as a dimension to health by WHO. And this, recently I was delivering a lecture. It is whether it is medical care or healthcare system. So what has happened is, basically we are so actually unfortunately tunnel vision. We are bothered about drugs, we are bothered about this and that, and ultimately we feel that is an answer, which may not be an answer. It is a part of the problem. We need to address that. Not that actually I am against it, but basically it is a minuscule of the problem which we are attending to. Basically, there are 3 points which we need to remember. One is IQ, that is controlled by the left brain. And the second, the latest trend is it is EQ, that is controlled by the right brain, where we need to actually see the patient as a whole. We need to see the patient as a whole with his family member. Ultimately, try to actually address the issues so that this actually not going to linger and become a chronic problem with the patient. And this is EQ is trying to actually become empathetic, compassionate, not just sympathetic. It's easy, just trying to accident occurs, say and lip sympathy. That's not going to answer. Put ourselves in the shoes of the patient, feel for the patient, and ultimately try to address the issues. Try to find the problem, decipher the problems, ultimately find a solution to the problem, and try to become a part of the solution so that the actually problem reaches actually as part of a solution to the logical conclusion, and ultimately patient and the beneficiary and the whole family should get the benefit. There is a time all these so-called different actually symptoms and signs which are not answered, and ultimately we brush aside, especially any neuropsychiatric issues, we brush aside and ultimately say there is no organic basis and ultimately it's functional. Ultimately we try to actually say he's trying to excuse, he's trying to find an excuse, a don't curry and all that. No, my brothers, no, my sisters. We need to address this, and possibly in case each one of us can adopt one patient, each one of us can adopt one family. For example, that I'm going to come and the patient actually, when we come to that, I'm going to talk to that about it. Another few slides are there. So basically, we remember this area, unfortunately, the medical system, our healthcare system has failed in toto. It's a complete failure. And this is where we need to address, especially how to go about. If in case one patient and one patient family can be adopted by one, actually the BENFA member or one doctor, one family, goes on and on. Ultimately, we go a long way in addressing the issues related to neuropsychiatric manifestations. Right. Renal sequelae, well, it is only 5% of people who get acute kidney dysfunction. But in case it is critical patients already who develop with multiple comorbidities, if they develop actually kidney problem, especially long-standing diabetes, it is about 30%. ultimately only about 50% actually they need a follow-up by a nephrologist. 50% they come back to the base, especially if it is acute kidney injury, where it is acute and chronic or multiple comorbidities. We need to make sure that we are going to address the problem, refer to a nephrologist, and ultimately take care. Management consideration, as I told you, especially there are AK survivors clinics. This is what we need to do, especially with actually patients who develop acute kidney injury. Well, this is one area where we are finding it very common in India. Patients actually, they were not diabetics, and especially, unfortunately, COVID is unmasking diabetes. Pre-diabetics are becoming over-diabetics, and the presentation has been with diabetic ketoacidosis. And these are the people, actually, when they come to us, actually with severe diabetic ketoacidosis, with a pH of 7 and less, yeah, where bicarb is about 4, ultimately, where the patient has acidotic breathing, they do respond for dialysis, and we electrically intubate them. We happen to do it 2 or 3 patients, and they completely recovered. So either they can present with diabetic ketoacidosis. Well, that is not the time to know whether it is type 1 or type 2. Basically, a big chunk are actually more than 30. Type 1 is more in youngsters. But for that, when the patient recovers, there's a time when we can go in for actually postprandial C-peptide levels. We can go for autoantibodies to try to know. But there is a subset of patients who are type 2 diabetes mellitus, and they are actually prone. So basically, them as diabetic ketoacidosis, and they present with acute COVID, or interestingly, they recovered completely, and they come to us actually, unfortunately, with diabetic ketoacidosis weeks to months after resolution of COVID-19 symptoms. Similarly is the case with thyroid. It's actually thyroid. Ultimately, it is autoimmune problem, and ultimately patient we can potentiate Hashimoto's, Graves, and we need to actually possibly as a routine, especially when the patient has palpitations, it is wise to do thyroid levels to know what is happening. And subacute thyroiditis, if it is there, that subset of patients we do respond, especially with pain on swallowing, with a small dose of steroids for actually a couple of weeks, and they do well. Next slide. And regarding actually this viral fecal shedding, it is known, very common. Yeah, it can be there for almost a month after actually the onset of the symptoms. And in case they become negative, it can be for about, mean is about 12 days. Yeah. So there is one actually organism, Faecalibacterium, it is anaerobe. Yeah. It is actually, it is helpful. It lives actually, it is a symbiotic, it is a symbiosis with the body system and inversely proportional to good health. But unfortunately, this is, we're going to lose. Inversely, it correlates with the disease severity. So basically, the problem occurs is actually in an Indian scenario, can this patient use the same toilet, and others, actually normal people in the home can use the same toilet because they have only one toilet. They don't have actually attached bathroom for all the patients. It is a very rarity to find. In such cases, what we advise is, possibly only thing they can do is actually flush the toilet at least about 2 or 3 times. 3 times is better before some second actually household member who is without infection can use it. This line. This is very common. Top actually hair loss. 20% they lose it. This is attributed to telogen effluvium. Yeah, and often it is very common because of stress. Don't worry about it. Once actually stress goes, it actually they're going to come back. Then if they don't come back, possibly you need to see a dermatologist not before 3 months or 6 months. This is a very important area where actually possibly a passing mention I need to make what is called as MIS-C, multi-system inflammatory syndrome. Very common in actually pediatric age group. And especially this is going to be more common actually, and it is not uncommon in adults, possibly it is not picked up. And we are seeing a lot of patients with actually similar symptomatology, though they say it is less than 19 years according to WHO or less than 21, yeah, where the patient, they come with again a fever, repeat fever, all the inflammatory markers arise, there is multiple organ dysfunction, either there is actually current or recent actually COVID infection, which can be actually detected by RT-PCR, but all this is subjected to excluding other possible diagnoses. And basically here where we lose out, and these people come late after a few weeks, and presentation is with fever, abdominal pain, vomiting, diarrhea, skin rashes, mucocutaneous lesions. They have actually low BP, and sometimes they do collapse. They can have cardiovascular and actually neurological compromise. And especially they mimic what is called as Kawasaki disease, which I'm not going to actually elaborate. But basically a similar syndrome, multi-system inflammatory syndrome in children, possibly we might see in future, especially a lot of neurological complications can occur, like headache, altered mental status, encephalopathy, multiple cranial nerve palsy, stroke, seizures, as I told you, Guillain-Barré syndrome, etc., etc. It is more common, especially post-COVID. And this is actually what we need to get prepared for the people who survive, especially in case if they develop this especially in adults, which of late it is uncommon, that is especially after the first wave. Second wave, still we are through this in the thick of it. So only time is going to tell us whether this is going to actually come back unfortunately in future. We need to get prepared for that. And for that, there are some treatments, especially what we need to do is treatment for this is actually there are immunomodulatory treatments, intravenous immunoglobulin, again steroids, though it is blamed for actually unfortunately mucormycosis. I purposely actually omitted that just to give a passing mention. Still has a big role to play, especially in these cases. Of course, low dose aspirin, I told you about 75 milligrams, that is going to help. And when the patient is actually asymptomatic, actually documented actually thromboembolism, we need to definitely go in for anticoagulation. Better to go for especially low dose aspirin with preferably dabigatran, as I told you, where we need not monitor INR. And this is where we lose out. Yeah, we are so religious in giving medicines. Yeah, all dawa khaini. And people die of actually dawa. That's all. Okay, where we lose out is actually nutrition. Actually, I tell to my residents, especially, there are actually 7 wonders in the world that we know. Eighth wonder of the world is spectacle, where we are able to see after 40. Spectacles, glasses we wear. 9th is Ryle's tube. In case actually, especially when the patient is in hospital, actually when they are hospitalized, and that is a time when they have feeding difficulties, they don't have smell at all, actually they don't feel like having anything, and especially the saturation is falling. Often I make it a rule, especially trying to counsel and prevail and try to request the patient to have Ryle's tube in. And especially nutrition, maybe it should be what the patient eats. We should not give a diet chart what the patient should eat. Modify what the patient eats at home. And especially when, mashallah, nuclear families, unfortunately, elders, they are a boਝ and burden to the family. Allah ko khalao gato, mashallah, they're going to show the door to the grandparents. This is the reality I'm telling you. So basically, modify what they eat. Make sure it is actually more than being grandmother and grandfather friendly. It should be, mashallah, daughter and daughter-in-law's friendly food. So that is easy to prepare, and ultimately, especially graded fashion, keep on increasing. And especially, हमना बचपन में जैसा अम्मी अब्बा ये कौवा ये कबूतर दिखा को खला है. This is what we need to do every 2 hours. We need to actually, especially good hydration, mashallah, plays a major role. Good nutrition, we go for all latest formulas. It's absolutely waste of money. Possibly homemade formulas, but our grannies, what they used to do should go in a big way, especially ganjis, ragi malt, ragi ke ambal, tarkari ka soup, and mashallah, haddiyon ka soup, and all this. Along with that, what I tell them is, mashallah, fresh fruit juices. This is going to help go a long way, and especially exposing these poor old people and people who are chronically actually invalid to sun rays in the morning for about an hour, followed by a glass of milk. When sun rays, mashallah, vitamin D2 is going to get converted to vitamin D3, and ultimately that is going to absorb avidly calcium from milk. So I tell them actually, after they get exposed to sunlight for an hour, let them have a glass of milk, and before they go to sleep, I never prescribe any vitamins to any of my patients. I tell them, mashallah, season ka phal khao, any seasonal fruit. It contains enough minerals, enough vitamins, enough trace elements, whatever you want, and that is made freely available, and it's cheap from Almighty Allah to even a common man, and that is never used. Hamay banaya so capsule kadwe, Allah banaya so capsules meethe, and that is cheap, and that is what we need to counsel the people to take seasonal fruits. which are cheap, and that is going to be a rich source of, mashallah, the nutrition for these poor patients who are rich in material. Next, this advocacy group, I'm not going to, is all for the West. Possibly the advocacy group is families and mashallah joint families in Indian scenario. The same thing, mashallah, these slides you can have it with you. That's what I have actually again summed up, so that how to go about in a given scenario when it is actually post COVID, when it is called as post acute COVID, when you call it as chronic, how to go about, how to actually decipher and clock this patient, ultimately try to counsel this patient and go for primary care, and when to refer to actually a patient to a nephrologist, and when actually we need to actually go in for a chronic actually treatment, and basically nutrition plus or minus oxygen. Slide. And of course, one of the major complications post-COVID, which is often forgotten, is death. We have a consultant surgeon who is a mashallah senior surgeon and a professor of surgery. Whenever he is to counsel actually patient for operation, बैठ कर पहला बोलते हैं, पहला complication is death करवाओ. We never actually post-COVID actually one of the actually COVID we lose actually patients, near and dear ones. How to approach, how to counsel, and now it is a time when everybody is becoming a widow or a widower or a teen. They are single parents. I remember when I was in UK, the small actually the child was a drug addict, young fellow was a single parent, middle age was divorced, old people are lonely. Now, in case if I try to actually extrapolate to the whole world, today young people, young children, they are actually without parents. Big chunk are yatim, yasir, plentiful. It's all actually fellow Indians, Muslims or actually our non-Muslim brethren. It is a harrowing experience to see. Absolutely, something we cannot believe what is going to be post-COVID scenario, especially in Indian subcontinent. Two, actually losing husband, losing wife, plentiful. They are going to be actually, unfortunately, you're going to find plentiful, unfortunately, widows and widows. And three, because of lockdown, familiarity breeds contempt. There is definitely a rise in drug addiction. There is a rise, actually, unfortunately, in domestic violence. There is a rise in divorces. There are going to be divorces and people divorcing each other. Family terms are going to rule, especially in educated lot, because we take pride in following the Western world, what they're doing. Ultimately, we're facing, especially the wrath. Presently, that's what I'm saying, especially in Indian scenario. Now, with this, especially after the patient dies, what about the next meal? People are not finding money to cremate actually their dear ones. They don't have enough money to actually bury their young, actually loved ones. And so many, actually, the fear of contracting the disease, they don't actually come and claim the bodies. Ultimately, it's left to NGOs or the hospital authorities to actually take the body and actually cremate or bury it. And that is happening in India, which is never heard of. And ultimately, they take the body to the Khabristan and graveyard, and ultimately leave the body at the door of the Khabristan. They don't get in. All this, actually, we never actually think about this. Basically, here where we need to address, try to actually, it's a holistic approach post-COVID death. One is how to counsel. What are we going to do? And एक ज़माना था कि भी retail मौत. आज का ज़माना is wholesale मौत. What are we going to do? How are we going to address this? Who is going to address this? And we need actually, mashallah, we need to remember कि आज उसकी बारी है. कल I can be one. I can lose my dear and dear one. Ultimately, this is a time. कि एक बहुत अफसोस की बात ये होती है कि भी people, they are grounded. And especially second wave, what I'm seeing is it is more common among educated lot, more common among intellectuals, more common among rich people, more common among people from posh localities, more common among people who are grounded for more than a year, who have not seen the sun at all for 1 year. The index case कहाँ से आता है? अल्लाह की तरफ से. अल्लाह के नबी ने सल्लल्लाहु अलैहि वसल्लम ने फरमाया कि जहाँ ताउन है वहाँ पर मत जाइए और वहाँ से बाहर मत जाइए. पता नहीं कहाँ से लोग they took it actually try to माशाल्लाह उनका own interpretation. घर से मत निकलो, घर को और उस घर को मत जाओ. No, don't go to the place. It's there. उस जगह मत जाओ. Now it is a time, get out of the house. And it's a time, mashallah, we need to work on. It's not enough to, mashallah, थोड़ा पैसे दे दिए. No, अल्लाह ने 7 चीजें हमको दिया है. जान, माल, वक्त, दिल, दिमाग, जज्बा और सलाहियत. इन 7 चीजों को झोंकना चाहिए. and we need to prepare, mashallah, our women folk also to do this job. This is the right time to, mashallah, jang ke maidan mein hai. We are fighting a jang with our own self, with our nafs, so that, mashallah, is the time ke bhi je apne jaan ki parwah nahi karna hai, apne je hai, mashallah, family ki parwah nahi karna hai, get out to help, mashallah, the ailing humanity. The people who are dying, Allah के नबी सल्लल्लाहु अलैहि वसल्लम ने फरमाया, सारी इंसानियत, माशाल्लाह, सारी मखलूक, बल्कि सारी मखलूक अल्लाह की आयाल है, अल्लाह का कुंबा है, अल्लाह की फैमिली है. अल्लाह उनसे मोहब्बत करते हैं जो अल्लाह के जो मखलूक से पर एहसान करते हैं. एहसान क्या है? जो सारी चीज अल्लाह ने दिया इसको झोंकना, अपनी चीजों को मखलूक के लिए झोंकना. This is the time. Enter into the battlefield. अपने नफ्स से जिहाद ये है कि भी माशाल्लाह don't care about our life. इस्लाम में ये नहीं है कि भी एहतियात मत करो, जरूर एहतियात करें, सोशल डिस्टेंस मेंटेन करें, मास्क लगावें, हाँ माशाल्लाह सैनिटाइज करें अपने आप को बार बार. एहतियात करके काम करने को कहा जा रहा है, एहतियात करके बचने को नहीं कहा जा रहा है. ये पता नहीं कहां से आ गया कि एहतियात करके बचो. एहतियात करके काम करो, get out and ultimately माशाल्लाह help the ailing humanity. This is what we need to do wherever we are in any part of the world. कि भी माशाल्लाह get out to help this unfortunate victims which they are, वो ऐसा नहीं कि भी वो मासूम थे और जो बेगुनाह वो गुनाहगार थे इसलिए अल्लाह ने उनको पनिश किया, नहीं, बल्कि जो जा रहे हैं वो तो बच गए, उनको शहादत की मौत मिली. लेकिन हमारी जिम्मेदारी है कि भी क्या अच्छा होता कि हम जो माशाल्लाह इन बच्चों को अडॉप्ट करते. मेरे 4 बच्चे हैं माशाल्लाह, और 2 को ले लो भाई, 6 की फैमिली, 2 बच्चे हैं और 2 को ले लो भी 4 की फैमिली. और इसी तरह माशाल्लाह भी अपने अपने उलमा से मालूम करके फाइंड आउट द मसला ऑफ द एरिया. क्या प्यारी हदीस है अल्लाह के नबी सल्लल्लाहु अलैहि वसल्लम की, जब माशाल्लाह जो शहद जब जो मक्खी दूध में डूब जाती है, मर जाती है, तो हदीस में आता है कि वो शहद की क्या हो, मक्खी को डुबा कर उसके बाद उठाओ. क्यों? कि भी एक पर में जो है माशाल्लाह पॉइजन, दूसरे पर में उसका एंटीडोट. कि भी जो एक पर में जो है माशाल्लाह जहर, दूसरे पर में उसका तिरिया. और शायरी ने हदीस में अजीब बात लिखी है कि भी इस हदीस से इस तरफ इशारा है, मसला जहां है मसले का हल भी वहीं है. घर के मसले का हल फैमिली कोर्ट में नहीं है, और इस मसले का हल माशाल्लाह आपका मसले का हल पैंडेमिक का उस एरियाज में है. क्या प्यारी हदीस है, डोंट लीव द एरिया, डोंट गो टू द एरिया. वो एरिया वाले माशाल्लाह छोटे छोटे यूनिट बनाकर सब कुछ अल्लाह ने जो दिया है मखलूक के लिए झोंक दो. एक गोल्डन अपॉर्चुनिटी है माशाल्लाह. हाउ वी कैन रिहैबिलिटेट दिस अनफॉर्चुनेट विक्टिम्स. 10% are the people who unfortunately they suffer, who suffer ultimately. So this is what about the next meal? Where are we? KBJ, next slide. KBJ, इसीलिए take home messages. Given the global scale of this pandemic, it is apparent that the healthcare needs for patients with sequelae of COVID-19 will continue to increase for the foreseeable future. We need to rise to the challenge. We need to harness the existing outpatient infrastructure. We need to go for a scalable, not medical care system. Go for healthcare models. Integrate all various disciplines. And this is a time when we need to, mashallah, अपना रुख रुजू इल्लल्लाह, अल्लाह की तरफ रुजू करना, अल्लाह से भीख मांगना, so that इस वबा से सारी इंसानियत को अल्लाह जो राहत दे, and address to their actually neuropsychiatric manifestations. For that, try to rehabilitate and ultimately address the social issues. Of course, physical health, everybody is bothered and everybody is, mashallah, overdoing those things, including drugs, of course, including vaccination, which we need to actually cling to. That is just about 5% of the problem which the whole world is facing, not the patient alone, not the survivor alone, but including the family members in the long term. Thank you.
Thank you very much, Dr. Saab. Thank you very much, Dr. Saab. Thank you very much for the very nice presentation. I just want to repeat one statement or one, definition what Dr. Saab has said, that health is a state of complete physical, mental, and social well-being of a person, not mere absence of disease. This is the WHO definition of health. So here we should know, as Dr. Saab said, that it's not just medical treatment. When we talk about the treatment, it's a holistic approach it should be. We have to take care of physical, mental, and social. Then only we'll be treating a person. So right now in this COVID crisis, most important one medical is there. Apart from that, the social support, social treatment, it has become a very, very vital role, and it is our, as human beings, as Dr. Saab said, it is our bound duty to take care of our fellow beings, inshallah. So now please I request audience to raise their hands so that we can go for question answer session with Dr. Altaf Sahab. Please raise your hands who wants to ask the question.
Assalamu alaikum, Dr. Sahab.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Alhamdulillah, it's a basic question just to ensure that we are all following the correct protocol. Since most of our brothers from NGOs are on field level working with regards to contacting the patients, visiting the hospitals to ensure that the oxygens are being delivered, and most of the NGO brothers who are working on a field level are visiting to houses to ensure that they are delivering cylinders, oxygen cylinders, and they are also contacting patients. So post which once we come back houses, we obviously get sanitized. We also take showers. So do we have to do anything extra apart from this?
Yeah, one thing is, mashallah, very good question. Jazakallah khair. A lot of people are doing a good job, but mashallah इसका थोड़ा भी बहुत ज़्यादा है, लेकिन बहुत भी थोड़ा है. जितना हो रहा है, mashallah, the calm at ground level which we are in Bangalore, which we are facing is हाथी के दांत में खशखश. So सबको हमको ये इंशाल्लाह लेना है ये जिम्मेदारी. Regarding once they come back, actually, unfortunately, remember this virus, unfortunately, it never, especially people are used to cremating people or burying people, it never, ever spreads by a dead body. The only time this virus spreads is very clearly we need to remember is, especially so that this fear psychology has been created by everybody very commonly is, if somebody is going to cough who is positive patient and infect you at that point of time directly on the face of somebody else, or somebody actually is doing a aerosol procedure during intubation. This is the area where, mashallah, cough etiquettes are going to help, physical distance is going to help. Ultimately, that's what we need to do. Coming back, mashallah, it's a good habit. After, mashallah, coming back from anything, any activity, wuzu karna, mashallah, is very good. Okay, that is enough. साथ में अगर कोई नहा रहे हैं, all the more good. बल्कि हदीस में आता है कि भी कोई पेशेंट की इयादत के लिए जाओ, हदीस में आता है कि वुजू करके जाओ और अच्छा वुजू करके जाओ, तुम्हारे और जहन्नम के दरमियान 70 साल की मुसाफियत हो जाती है. सुभान अल्लाह. इट इज नॉट हैंड वॉशिंग. इस्लाम सेज कि माशाल्लाह पूरा वुजू करके जाओ. ये हम अपने बारे में हम नहीं जानते, हमारे माशाल्लाह इल्म के दिन के बारे में. बेसिकली दिस इज व्हाट इट इज कि ये पूरा वुजू करके जाओ. माशाल्लाह, वेर इट इज फॉर पीपल हु गो टू अटेंड ए पेशेंट, खैरियत पूछने वालों के लिए. डॉक्टर्स के लिए अच्छा है कि माशाल्लाह नहाकर जाएं, वापस लौटने के बाद वापस आके नहाएं. और पीपल हु अटेंड टू पेशेंट कोविड पॉजिटिव वापस आकर सैनिटाइज करें, बेटर ये वुजू कर ले, आखिरी दर्जा अगर नहा ले तो बहुत अच्छा है.
Jazakallah, Dr. Sahab. Alhamdulillah. This has been a regular exercise for us actually, to being on wuzu all the time, which is actually the actual sanitize what we believe. Alhamdulillah. So thank you so much for your response.
Okay, just to brief about Muzammil Bhai, who was asking the question right now. He is the Joint Secretary of BENFA, and Alhamdulillah, jitni bhi tarif kare, how much ever we praise to him is less, because he is working very, very hard on the field. Any time, any night, 3 o'clock people are calling, he's delivering oxygen cylinder to their whole house, to their doorsteps. May Allah grant him bounties, bless him with bounties in multiple folds. Just a brief introduction about himself. Now I request Mr. Ramesh Shinde to ask his question.
Yes, sir. Sir, my question is, hello,
yeah,
can you hear me, sir?
Yeah, please go ahead.
Sir, doctor, please explain about black fungus and its treatment. My first question. Second, please brief about the third wave and how to take care of kids. And third question is, doctor, how to boost immunity in natural way. These are my 3 questions. Kindly explain me.
Wonderful questions regarding wantedly actually escaped mucormycosis and black fungus. It is definitely on the rise because of indiscriminate use of steroids, actually because of humidifier in the hospitals not being washed regularly, and they are being filled with tap water instead of distilled water, and because of immunodeficiency. And this actually, unfortunately, is going to be an epidemic over time, especially post-COVID, especially in long-term diabetic patients. So basically, we need to go for what is called as mucormycosis clinics, which alhamdulillah they are springing up all across India, Mashallah, there is one in Shifa also, where we have a full team with AED surgeons, neurosurgeons, and we have actually head and neck surgeons, with ophthalmologists, with dental surgeons, that we just starting from Monday. So basically, fortunately, this is an area which is subset of patients. They are going to develop these complications. How to pick up is anything that is going to cause post actually COVID, stuff in nose, or watering of the eyes, swelling of eyes, anything related to sinus pain, we need to be a little careful, or pain in the teeth. So it could be varied manifestations, but basically, possibly it is very nice. Normally what we do is we make sure that we call all our patients 14 days after we discharge the patient, and mashallah, we see the patient clinically. So we can pick up early. And during COVID treatment, mucormycosis can occur even during actually acute COVID also. But post-COVID, we are losing a lot of patients in a lot of areas in India, across, especially in some states. So basically for this, it is a multidisciplinary approach where we go for amphotericin. And of course, in the case of diabetes, because of kidney involvement, we have what is called as liposomal amphotericin, which is a costly drug. Ultimately, it's a costly treatment, costly surgeries. Ultimately, it is nobody should get mucormycosis. That's all I'm going to say. It should be prevented, possibly be repeated. Actually, steam inhalation post-COVID, it's going to be very helpful. And of course, actually trying to be judicious in using steroids and a good control of diabetes. And second, regarding actually immune boosters are, mashallah, what our friend Joint Secretary is doing. Biggest immune booster is, mashallah, trying to help others. Be happy all the time, yeah? And mashallah, respect others. Respect others, mashallah, by supporting us, supporting others. What we can do is, for this, I'm going to tell you what to do. Just a brief of it. You can just make a note of it if you are interested. How to go about. It's very, very easy to do that. Yeah, this is what we need to do. This is actually very interesting, because thanks for that what you've asked. This is a very important question. Just a minute, I'm sorry here. What you can do, my brother Ramesh Shinde, is this actually helping others, compassion, empathy, being happy, trying to help us is going to give a lot of immune booster. And this, with due respects, this is what I keep telling. There is one is killed vaccine, one is life attenuated vaccine. Lot has been spoken by Alhamdulillah Hamid. Hats off to him. One I say is actually super life vaccine is people who are positive, be positive, and they visit actually households. One is what is called as, by repeated exposure to the virus in graded fashion, is going to lead to active immunity, and that active immunity is more long lasting than because of vaccine. This is what immunology teaches us. So basically, this is what is going to give a big immune booster to us. And the second question I forgot. What is the second question I had?
About the third wave, he was asking.
Third wave,
yeah.
Regarding third wave, see, this is more of a prediction, and ultimately on what basis they're telling it is going to be children, it is going to be this. Well, there are a lot of theories, including conspiracies, theories, and etc. We will leave it at that, and ultimately, as rightly put by Hamid, once we actually, about 60 to 70% of people are going to get infected by actually virus, either by the disease process or by vaccination. Vaccination also is inducing the disease. We need to remember, either killed or live attenuated vaccine. So basically, if 60 to 70% are actually infected, the rest 30% they get herd immunity. So basically, this is possibly in case if we can increase the vaccination drive. I'm not going to actually, for Allah, God forbid, patients to get infected. That's not the way to ask. But vaccination drive should be actually, possibly we need to increase it. And that about 60-70% are actually, they're going to be vaccinated and they're going to get infected. Then this 30% of kids, automatically they're going to get immunity. And even if they get actually disease, fortunately we've seen the disease is very mild, very mild, very mild in children, adolescent and pregnant women.
Hope our brother Ramesh Shinde got all answers.
Thank you, sir. Yes, sir. Yes, I got it, sir. Thank you so much, sir.
Okay. Now
Thank
I
you for the
request I request Rahmatullah Bashir Saab to ask his question. Rahmatullah Bashir. रहमतुल्लाह बशीर, अनम्यूट करके प्लीज अनम्यूट योरसेल्फ. रहमतुल्लाह.
Assalamu alaikum to everybody. I am the new member and I have been given this golden opportunity by Dr. Suhail. I wish to, from the bottom of my heart, I wish to thank him for inviting me and making me as a member of BENFA. He's such a great persona. He came into my life as an angel. And when my wife was admitted in the hospital, from no man's land he came up. And I was in nowhere in the world. What to do, how to contact, and all. He has played a tremendous job in saving my wife. She's back home, alhamdulillah, alhamdulillah. For this, I assure all the BENFA members, I am going to do wonders for BENFA. I'm really going to do wonders for BENFA. The credit goes to Dr. Suhail.
MashaAllah.
Nothing I did. I did not do anything special. I was posted in ICU in Dammam Central Hospital, and your wife was one of the patients with me. That's all.
I wholeheartedly, you were one of the angels who's made my wife survive. And now I have a small question. She's back home and she's getting slight swelling on the legs, that is near the fingers. Any remedy for that? Any doctor can give me a suggestion for this.
Dr. Altaf Saab should be the...
What is the question, sir? I'm sorry, Vajan.
Okay. My wife is getting a slight swelling near the legs.
Achha, this basically, as I told you, very, very, very important. They need to ambulate, be on their toes.
Okay.
Actually, basically, what you can do is see if there is any calf muscle tenderness, and we need to actually, in case if it is persistent or it is going to be swelling one more than the second limb, it's better to do a venous Doppler and actually rule out DVT. Otherwise, actually keep quiet, just give some anti-inflammatory analgesics.
What is that anti-inflammatory? Can you suggest me? I can get it.
Anything, mashallah. The best anti-inflammatory analgesic is actually any local ointment. Jantar Mantar, Zindatul Ismat. I go for home remedies more local. Then actually Dole of 650 just analgesic is enough. That is enough. Others go for ibuprofen. Any ibuprofen is should enough. Try to avoid drugs in people beyond 60.
Yeah, but she's because Dr. Suhail Saab can give me the suggestion. Yeah. So he's here. I'm very close to him. A distance of just 20 kilo. And one more, a remarkable person. Remarkable. I have no words. I have no words. Out of the blue, he came as a shining star and he became a moon for me to save my wife.
Alhamdulillah.
All the praise to Lord of the Worlds.
Yeah, hats off to you, Dr. Saab.
Thank you very much. Okay, now next we'll go to Muhammad Ilyas Sahab. Please unmute करके बात करें. Muhammad Ilyas Sahab.
Hello. Assalamu alaikum.
Walaikum salam.
Assalamu alaikum. Doctor Sahab, during your lecture you told us घरों में नहीं बैठना, बाहर निकल जाना, ये करको बोले आप अल्हम्दुलिल्लाह उसे मानेंगे. What about the government is doing? You should not come out from the home. You stay at home. Please stay at home. किसकी बात मानी, किसकी बात नहीं मानना वो मालूम नहीं.
अच्छा, it's a very good actually question by इलियास भाई कि भी माशाल्लाह 4 दीवारी में रहकर who is preventing morning जो है 6 to 10 खाने के लिए, खरांगू चीज़ लाने के लिए, गोश्त लाने के लिए, सब चीज़ लाने के लिए, हमें तो भूखे नहीं मर रहे, पड़ोस भूखा मर रहा है, क्या करती? Nobody, the government is also telling you not to go to other localities. It is not actually, we should not put in own locality. Don't use a vehicle, घूमते फिरते रहो कर. Become volunteers, come to actually mashallah hospitals and you can help a lot. Where mashallah पूरे निकलने की जरूरत नहीं है. What we can do is mashallah जो है only question of अंदर intention हो तब अल्लाह रास्ते खोलते हैं. इसके लिए अल्हम्दुलिल्लाह कि follow the guidelines of the government completely. उसमें कोई जो गुंजाइश नहीं. बल्कि गवर्नमेंट is very very clear. अपने localities में morning when we move 6 to 10 we can go for all our needs. मैं जैसा बताया था अभी adopt one family. उनकी भी जरूरतों को पहुंचाना है. बीमारों को जो ग़िज़ा पहुंचा डालो, गंजी पहुंचा डालो, माशाल्लाह फ्रूट पहुंचा डालो. Lot can be done, KP mashallah, and those people are volunteers. The 24 hours they're occupied, alhamdulillah. With government permission, we can get a pass. I can get a pass for you, inshallah, and your family members.
और एक छोटा क्वेश्चन. अब वो पूरे बेंगलुरु के अंदर नहीं, पूरे हिंदुस्तान के अंदर, पूरी दुनिया के अंदर अच्छे डॉक्टर्स है ना, पूरे कोविड पेशेंट के पीछे पड़ गई. जो पुराने पेशेंट है, शुगर के हैं, बीपी के हैं, हार्ट के हैं, किडनी के हैं, उनको कोई भी एक अच्छा फिजिशियन नहीं मिल रहा. उसके वास्ते ये डॉक्टर्स की ग्रुप क्या सजेस्ट करती है?
माशाल्लाह, दिस इज अ गुड क्वेश्चन. एनीवे, आउट ऑफ द बॉक्स फॉर दिस गैदरिंग, बट इतना है कि माशाल्लाह जो है, देयर आर डेफिनेटली वी आर अटेंडिंग टू नॉन कोविड सेक्शंस हर जगह है, इंक्लूडिंग शिफा में माशाल्लाह वी हैव अबाउट 40 बेड्स, इंक्लूडिंग वी डेली 24 आवर्स वी आर अटेंडिंग टू ऑल दोस पेशेंट्स. अलबत्ता डॉक्टर्स हमने डिवाइड कर लिया है कि ये कौन कोविड को अटेंड करते हैं, कौन नॉन कोविड अटेंड करते हैं. अल्हम्दुलिल्लाह, दैट यू कैन कांटेक्ट अस इंशाल्लाह.
Okay.
Thank you.
Okay. Very good and very practical questions थे आपके मोहम्मद इल्ला साहब. जज़ाकल्लाह खैर. Now I request Dr. Wajhat Sahab to ask his question. Dr. Wajhat Sahab, please unmute.
Yes, okay.
Assalamu alaikum, Doctor. Doctor, for a fantastic presentation and for a long time had the opportunity to hear. And actually, I want to bring to the notice of the audience that Alhamdulillah, Allah is taking a big work from Dr. Saab. He is staying put in the Shifa hospital for last 40 days alone and commanding his army of doctors and paramedical staff. And Alhamdulillah, he is on the war front. Dr. Saab, one clarification I want. During your talk, you told about the thrombotic and thromboembolism in the post-COVID period. What is the statistical data of post-COVID thromboembolic phenomena compared to post-vaccination thromboembolic phenomena you are facing and you are getting inputs? Because you are in the field, you can compare whether thromboembolic phenomena post-COVID is more or of last few days or last few weeks. There has been some statements of post-vaccination thrombosis causing complications. If you can just put some light on based on a practical input you have got.
This basically can only talk to you about the studies which have happened in the world and what they claim, because we don't have an access for all that studies. Basically, secondary to COVID, definitely they say it is about 5%, which is possibly underreported post-COVID because the sample size was small. Definitely it is more than 5%. It could be anywhere between 5 to 20%, especially related to COVID, especially if they are comorbid conditions, diabetes, long-standing obese people, and they are not ambulant. But regarding vaccines, what actually they claim so far, because it is need to follow up for quite long, especially vaccine has started, especially about 3 months ago. So basically, we really don't have statistics, but they claim it is 0.1%. Regarding only studies they claim, but I actually am not a luminary in that field to talk to you about practically what is post-vaccination. But vaccination has its own problems. But mashallah, we are between a devil and the sea. So we need to accept it because severity of the disease is definitely, they claim, is less post-vaccination, though the complications are not rare.
One sub-question in this thing. During the COVID stay of the patient in the hospital, have you encountered thromboembolic phenomena, or is it after 1 or 2 weeks only?
This actually, unfortunately, depends. As I told you, patients, they report to us late. Early in the disease process, they don't report to us. Infective period is first week, where is the replication of the virus. And that time, actually, inflammation is induced. All that inflammation and hyperinflammation, it is subjected to patient variant. Patient varies depending on how they respond to the given scenario. So usually it is in second and third week. And normally we have found at least about so far 8-10 cases in second wave. We have treated more than 2,000 patients by now in Shifa for COVID positive patients. About 8 or 10 with pulmonary thromboembolism. Suddenly actually patient deteriorating with actually tachycardia, and ultimately we have found and we have thrombolized those patients also in conjunction with our actually doctors, cardiologists, and ultimately, but unfortunately none have survived. So basically it is common during actually post-COVID period also, especially in second and third period, where they are going to mount an hyperinflammatory response, which we have no answer. Post-COVID, Follow-up, so far, unfortunately, we have not found many. Basically, we tell them be ambulant, be on the move. So only unless they develop symptoms, then only we do a venous Doppler. So far, fortunately, we have not found many. Because normally, our tendency is all patients, once they get discharged, they are on long-term anticoagulations for a minimum period of 6 to 8 weeks. Minimum, whether the D-dimer is normal or abnormal. Normal, they is on 75 milligrams of dabigatran. If it is more than 500, if it is more than 1,000, I put on 150 or 110 OD for 6 to 8 weeks. So we hardly see thromboembolic events after COVID.
Hello. Jazakallah, Doctor. Thank you so much. Jazakallah to the organizers also for giving us an opportunity to participate.
Okay, thank you very much, Dr. Saab. Now I request.
Hello.
Yeah, Dr. Fatima.
Yes.
Okay, please ask.
मेरा एक सवाल है.
हाँ पूछिए.
इसके ट्रीटमेंट के बाद, कोविड के ट्रीटमेंट के बाद कितने दिनों के बाद ये प्रॉब्लम इन्वॉल्व हो सकता है पोस्ट कोविड में?
Yeah, this is regarding that. जैसे definition में बताया था मैं, एक तो persistence of symptoms can continue from day one. It goes on and he never gets respite at all from the disease process. He was discharged with symptoms and that continues for more than 4 weeks. And एक होता है कि patient is completely asymptomatic and they develop sequelae after 4 weeks. So subacute बोलते हैं हम in case if the patient develops symptoms from 4 weeks till 12 months, and chronic बोलते हैं if it is more than 3 months to 6 months. So basically only 10% of people, 90% they are going to be totally 100% normal within a span of 4 weeks time. Out of the 10% unfortunate people जिनको अल्लाह की तरफ से माशाअल्लाह के प्यारे होते हैं, it's about 1 to 2%. Yeah, that's all. The rest is about 9%, 8 to 9%, and these are the people who are disabled, either persistence of symptoms for more than 4 weeks, or symptoms completely go away and there can be de novo appearance of new symptoms after 4 weeks.
अल्लाह करे कि इन आफात से अल्लाह ताला बचा कर रखे बस.
आमीन आमीन आमीन.
Okay, आमीन आमीन. Now I request Dawood Sharif to ask his question.
Assalamu alaikum. Thank you very much for the opportunity and real appreciation to the doctors who've been explaining these all the questions so patiently and so a lot of help. So Dr. Saab, my question is, during the vaccination, in between the vaccinations, first dose and the second dose, and after the vaccination, there is a very generic question. Consumption of medications in this period, medications like analgesics, antibiotics, and all these things. There are a lot of doubts with people. Can we consume those medications? Does it impact the vaccination capacity in the body? Does it, or does it reduce the impact of the vaccine in the body, or does it cause any other issues in the body if we take some other medications like analgesics, or because there are a lot of patients who consume long-term medications, etc. Can you please shed some light on that?
Very, very good question. Fortunately, Ajib, one general actually rule you need to remember. जब अल्लाह एक बीमारी देता है तो दूसरे से हिफाजत करता है. This is a general rule. कि कोविड मिलने पर what we have seen is lot of people who had blood pressure, the pressure becomes normal. And people on drugs, बहुत सारे actually mashallah have reduced them to minimum when they go home. They're asymptomatic. Basically, one is because the good reason they are not very ambulant, they stay indoors, fear complex, etc., etc. The requirement goes down in a very big way. Two, as I've already actually I've told you, best treatment is not drugs, nutrition. The drugs के बारे में I very, very clearly told, especially elderly में be careful. 65 3 drugs, 72 drugs, after 71 drugs. 80 में कोई डॉक्टर इलाज करे तो डॉक्टर का इलाज करना with drugs. This is what I keep telling, so as to prevent drugs. What we can do is we can use drugs sparingly. Okay, but डर की वजह से starting to use as prophylactically analgesics, no. पहले use actually local remedies, home remedies are definitely useful. In case if they don't work, all drugs are safe, including antihypertensives, anti-cardiac drugs, anti-cancer drugs, all are safe, especially, mashallah, in between vaccination, post-vaccination, absolutely no problem. But when it is immunosuppression, go for a killed vaccine, don't go for actually live attenuated vaccine. That has been very clearly told by Hamid. Okay, we need to go for a killed vaccine. That is preferable. That is not going to mount any response. Live attenuated, actually the disease process may come back with more vigor and ultimately we may lose the patient also.
Okay. So
Okay. Now I request Dr. Khurshid Ahmad Sahab to ask. Dr. Khurshid Ahmad Sahab.
Assalamualaikum. Sir, my question is, after post-COVID treatment, hello?
Yes, sir.
Yeah. After post-COVID treatment, whether it is mandatory to do the CT of the patients, CT of the thorax, whether it is mandatory to do, or and one more question is, if the D-dimer is fluctuating in the patient,
Can you remove? Actually, I'm not able. It's not very clear, sir. Can you
Dr.
repeat it?
Khurshid Sahab, if you don't mind, can you remove the mask?
Remove the mask and
face
ask.
shield?
No problem.
Because we are not. Your words are not clear.
Yes, yes. Sir, it is actually after post-COVID treatment, if the patient, it is whether it is mandatory to do the CT of the thorax to the patient. So whether it is mandatory, if the patient post-COVID treatment, the patient is recovered, if the D-dimer is fluctuating, so what is the actually treatment for the patient?
First question, what you asked, it is mandatory to
do the CT of the thorax to the patient.
No, fair enough. See, this regarding, I was very clear about it. No investigations, but for your kind information, I never do any CT or chest X-ray when the patient is admitted also at the time of discharge. Yeah. And normally I've asked for actually a CRP with D-dimer, with the HbA1, actually with CBC after 14 days. At that time also we don't ask any X-ray at all. Because X-ray changes, they take normally about 4 to 6 weeks for them to go. They are going to linger for some time. We should not subject the patient to radiation. And CT, it's like taking about 300 X-rays, chest X-rays. So right, left, we should not subject the patient to CTs also. So basically, as I told very clearly, if the signs and symptoms are going to linger for more than 3 months, that's the time we need to investigate, do a chest X-ray first, do actually a 6-minute walking test 2, do a PFT3, and do blood test 4. And then in case if they're abnormal, then go for a HRCT or go for CT, actually pulmonary angiogram.
Okay. Dr. Saab, any more questions, Dr. Khurshid Saab?
If the D-dimer is fluctuating in the post-COVID
regarding D-dimer fluctuation, in a subset of patients we see that can remain very high, about 7,000, 10,000. I have never seen in my actually practice of about all these years, D-dimer being about 10,000, 8,000. In such cases, what we need to do is 14 days after discharge, we do D-dimer. If it continues to be high, we need to continue dabigatran in the same dosages, at least about 150 OD. Some people do use BD also, and that we need to continue actually for 3 to 6 months. Know if there is a hypercoagulable state and try to investigate for that. In such cases, and ultimately that patient for provoked thromboembolic events related to lung, we need to continue anticoagulants at least for 3 to 6 months in those cases. And possibly it is wise to do a D-dimer once in 14 days.
Okay.
Thank you.
Now I request Mr. Farooq Ahmad Sahab to ask his question. Farooq bhai.
This is Aida Farooq here. Actually, I'm posing a question through my father. Am I audible?
Yeah, you are audible.
Yeah,
please.
So his question was that remdesivir is actually proved to not actually help much with COVID-19 patients, but still many hospitals, including Shifa Hospital, are providing COVID-19 patients with remdesivir.
Yeah. Very good question. MashaAllah. See, basically, we are all very, very good at actually taking what media tells and ultimately become brand ambassadors to them and ultimately pass the message immediately, thinking it is gospel truth. We have been using, actually, as I told you, first week is infective, replication of virus. And remdesivir is definitely helpful. 100 times I'm going to tell that. But basically, regarding toci and tocilizumab and regarding plasma, we are actually not very sure. And in the second wave, possibly we've used at force of the patient attendance in 2 or 3 patients so far, in about 2,000 patients. Regarding remdesivir, replication of viruses is more common in first week. The patient comes to us early, remdesivir is definitely helpful early in the disease process, and I have actually a big series which I'm going to present possibly over time actually as a paper. But this, unfortunately, whatever the media tells, whatever this is become our actually rule, we feel it is gospel truth. And this is not the forum for you who want me to discuss about the lobbies. Thank you.
Okay, thank you. Now I request Mr. Mohammed Ansar Sahab. Mohammed Ansar, please unmute yourself. I think he is not there. Are you there, Mr. Okay, now Ruhi Amir.
Assalamu alaikum, sir. This is nothing related to medical issues. This is something related very much to the psychological issues. In the beginning of your talk, you mentioned two aspects of the brain's functioning. One was the emotional, and the other was the IQ. Okay, in recent cases, as by my knowledge, I have seen wonders happening with people who are in the acute stage of COVID. A person who is in the ICU gets motivated, encouraged, and helped by a lot of counseling and motivation. What do you suggest for counselors like us? Would you suggest we interfere with these kind of steps like psychotherapy and a lot of counseling? Would it be like an intervention with the medical treatment, or would you feel this would be an additional help to the medical fraternity?
Mashallah, it's a very, very, very good question. As I told very clearly, IQ is controlled by left brain, EQ is controlled by right brain, and there is one latest concept is spiritual quotient that is controlled by both the brain side of the brains, both right as well as left, and that is what is giving a purpose to life, and that is what now they are talking about all over the world. Basically, this is a very important question what you have brought out. It's very, very, very necessary to actually intervene from the word go, especially in trying to actually allay the anxiety, try to actually counsel the patient, not only the patient, counsel the attenders, possibly a big job done. I keep telling to all my residents in actually treatment in ICUs, is stopping drugs and counseling and counseling only. And this actually we need to start from the word go, and it is not actually, and they're not coming in the way. Possibly we to start from the word go from the patient, not only patient, attenders also the same go.
So since I have been in the palliative care for more than a decade now, it's almost 12 years now I have been in the palliative care, and I feel counseling works wonders. So any kind of help from my end, I have been associated with Dr. Mushtaq also regarding starting up a palliative unit at your place. So if any kind of help from my side, since I am available at home nowadays, you could take my help as well. I'll be more than glad.
Jazakallah, definitely, inshallah. I'll be behind
without any ulterior motive. This is just Rahilillah.
Alhamdulillah, definitely. Jazakallah. Inshallah, we'll definitely try to utilize your services.
I have a PhD in emotional health, so you could please take my services as holistic.
Okay, thank you very much, Ruhi Amir. Now, Mr. Kashif Sahab, he is asking one question about Sputnik vaccine from the session 1. I request Kashif Sahab, please come forward and ask your question. I think this question is to Dr. Hamid Sahab. Kashif?
Dr. Sahab. Yes, doctor.
Yeah, please ask your question.
Earlier doctor said about dead virus and live virus. We need to know that Sputnik, what vaccine is going to come or it might going to come. So just wanted to understand about the Sputnik. So will it be in the from the dead virus or just live virus?
Dr. Hamid Sahab.
Yes, if Dr. Altaf, if you want, I can take this question.
Yeah, please, Hamid, it's your domain.
Where did I see you, Dr. Altaf, by the way? Okay, about the Sputnik virus, we don't have it in UAE yet, so I'm not very familiar with that. But from what we have read, this is one of the vector vaccines. The Sputnik vaccine, sorry, not the virus. The Sputnik vaccine is a vector vaccine. It uses a harmless virus, a type of adenovirus, and incorporates DNA material which codes for a genetic material of the actual coronavirus that causes the infection. So this works actually very similar to the Covishield vaccine, which is available in India. So there is a live virus involved, but this is a harmless virus which does not cause human infection. And the mechanism is very similar to Covishield. As far as efficacy, is concerned, from what we have heard from the manufacturing company, it is pretty effective, maybe even 90%. But I'm not aware of any published studies, so I would like to add a word of caution to that, because till studies are published, we really cannot, in peer-reviewed journal, we really cannot be 100% confident about what the companies say themselves. But it's being used in a lot of places, and it works very similarly to the Covishield vaccine. So when it is available, I would certainly not be averse to using it.
Thank you.
I hope that answers your question.
Okay.
So in a nutshell, similar to Covishield, except that it uses a different vector rather than what Covishield uses.
Alhamdulillah, now we have come to the last part of the meeting. I request Dr. Salim Mekri Sahab to give vote of thanks so that we will conclude today's meeting.
Dr. Sahel, I'm sorry. Can I ask one last question to Dr. Hamid, please?
Yeah, sure.
Thank you very much. My question happens to be, there are people who are in the part of Middle East and US, UK, etc. People have taken in vaccines like Pfizer, Moderna. Now, what is happening, what we are seeing is a lot of people who have been vaccinated with Pfizer or Moderna or Johnson & Johnson, when they go back to India, they're getting infected. There have been very limited stories which have been heard about loss of life, even for the people who have been vaccinated. So are these vaccines effective to the current strains in India? And if not, what one needs to do if he has to travel to India, or are these vaccines enough? Are they broad spectrum enough so that they can tackle any mutation of the virus which are happening currently? Can someone, either Dr. Hamid or the other doctor who is on the line, can they shed some light on this, please?
I can attempt to answer this rather difficult question. I say difficult because we do not have enough data to answer it accurately.
There's a lot of uncertainty on this. Yes.
Right. So I will tell you this much: the virus mutates, and it will keep on mutating. And this is just the normal progression of any virus. Every virus is going to change over time. And as the virus changes over time, you're going to have variation. This is what we talk about when we say variations. Now, there have been actually many variations of the virus so far. Many of them are still, the vaccines are still effective against many of the variants. Now, is it possible that there may be some variant which will, or against which the vaccine will not be effective? Absolutely. But this is a question for the unknown. I really cannot comment about, I don't have enough information to say whether the variants available in India are effective with Pfizer or not. I don't know the answer to that. Dr. Altaf, if you have anything else to add to that.
Thank you, Hamid. Actually, what I would want to add is, see, as Hamid is trying to tell us, virus, they mutate very fast with what is called as antigenic shift or antigenic drift. So by the time we realize it is going to be a different virus. And what they try to claim, actually, these viruses are actually effective against the variants. It's a difficult thing to swallow. The simple reason, actually, we are not very sure. We don't have any studies unless they try on that variants, and ultimately it is not there. The latest variant, which they say has originated from our country, actually, and it is called as double mutant. Possibly it is what they call 1617. So actually, whether it is effective, all these vaccines is a very difficult question to answer. But hopefully, because they say spike proteins or surface proteins they share, it may be effective, not fully, partly. So better at least get that partly effective that help from the given vaccination rather than trying to avoid it. This is what I can say. But as of now, we don't have any studies to say it is definitely effective for the new variants at all, which is unlikely to affect, because they're not studied on that virus.
Thank you very much.
Dr. Kuel Sahab, I have.
Dr. Mohammed Ansar Sahab, आप शायद नहीं थे. He was calling your name. You were not available, I think.
No, I was attending. I was attending.
Yeah, please ask your question. Your question will be the last question. Yeah, please go ahead.
Dr. Altaf Sahab, thank you very much. बहुत बहुत शुक्रिया, जज़ाकल्लाह खैर, आपके बहुत ही informative information था. और we have many patients because we are, as a part of COVID, we have received many patients. Some of the patients, even after 4 weeks, 6 weeks of the post-COVID period, their saturation remains 90-91 on room air. What will be your suggestion to further improve their oxygenation, whether to continue only steroids or any other possible methods? I need a little bit brief information regarding this patient.
Possibly this question Hamish should answer, but remember, especially patient on a background of any lung disease in the past, if he is a smoker, if he has comorbid conditions, if he is not ambulant, if he is obese, saturation of 91 is mashallah 100% for me. So actually, if the patient is not symptomatic on exertion, absolutely no need of giving oxygen. He can be his normal self. Mashallah, air contains about 21%. That should suffice. But basically, where patient is without comorbid conditions and patient is young, and in such cases, if it is less than 90, then we need to work up those patients in case if they become dyspneic chronically. Otherwise, especially COPD patients, smokers is very common, and if they're not smokers, we passively inhale smoke in India. So in such cases, our ladies are used to this chulla. Now it is less common. In such cases, in case if the saturation is between about 90, 91, 92, it's 100% for me.
Is it possible to enhance the level of the oxygen by physical methods?
By good physiotherapy, by breathing exercises, by getting out, be ambulant. How do you answer that better?
Okay, yeah. Now,
if I may add to that answer, so we have seen some patients like this. What I do as a first step is to see whether, whenever you're recovering from an infection like COVID that has injured your lungs, some people are going to take some time to recover from the lung injury. And during this time, their oxygen saturations will be a little bit on the low side. And unless their oxygen saturations are consistently below 88%, we don't really put them on oxygen. However, what I would advise though is make sure you're not missing something like a PE. If your X-ray or CT scan does not show enough lung damage to explain the hypoxia, these patients may need further workup. For example, maybe ruling out a PE or something. Because we have seen that too. We have seen patients being, blamed of having low oxygen due to COVID, but then they actually had a small PE as well. And in that case, they may need anticoagulation. So these patients basically need to be worked up, at least with some imaging. I mean, if the X-ray findings do not explain the hypoxia, they may need some additional workup. But it is not uncommon for these patients to have some degree of fibrosis or some degree of lung injury, which can take weeks to recover. And as Dr. Altaf said, as long as the saturation, for me, the cutoff is 88%. If it is above 88%, they can be fine. In fact, doing some pulmonary rehab, which I don't know how widely it's available in India, but we used to do it for a lot of our COPD patients in the US, can be helpful. And pulmonary rehab basically is just exercise. It's just walking under supervision as much as you can.
Thank you. One last question is there, which came on the. They are asking which vaccine in India has killed virus.
Correct.
Dr. Sahab, you are unmute. Please unmute yourself.
Oh, sorry. Okay, the kill vaccine in India is the Covaxin, the one that is locally made in India. That's the kill vaccine.
Covaxin is the vaccine which has killed virus, not attenuated virus. Okay, any other question? Yes. Last question, we can give chance to anybody if somebody has. I think no more questions. So now
sorry, Sohail bhai, Dr. Sahab, sorry, one last question.
Yeah, please go ahead. Please go ahead.
Sometimes what happens, we does not know we are affected with COVID or not. How to consider, there is antibody test, how to ascertain that we had a COVID or not while the taking decision to take the vaccine? That is one last question. You got my point, doctor? I want to know sometime
somebody will not be knowing whether he has been infected with COVID or not. That person, how can he decide to take vaccine? How to ascertain that he was not infected? Maybe he was asymptomatic or what? Maybe he has recovered naturally. That is my one question, sir.
Okay.
Altaf, do you want me to take that or?
Yeah, please, Hamid.
Okay, all right. So, what I would like to say over here is, yes, you can certainly do an antibody test, and the antibody test will tell you whether you were infected in the past or not. However, I would still advise you to go ahead and take the vaccine for your protection, because like I mentioned earlier, we do not know how long natural immunity lasts. And vaccines in general, the kill vaccines are proving to be quite safe. I mean, hundreds and millions of doses of vaccines have been administered all over the world. In US alone, there have been 250 million doses so far. And US is a very lawsuit-happy country. I mean, the moment you have any side effects from any drug, including vaccines, the lawyers just jump on you, and that hasn't happened. So from that, all of those things, we know that these vaccines are safe. So if you're not sure whether you have the infection or not, I mean, I would say take the vaccine. But if you don't want to take the vaccine, you can check your antibody levels, and the antibody levels will tell you whether you had the infection in the past or not. If your antibody levels are zero, you never had the infection.
In Saudi Arabia, they are now preferably only administering Pfizer. Pfizer is the vaccine of dead virus, or how it is? Pfizer.
Yeah. So Pfizer is one of those new vaccines that uses mRNA technology. It is neither dead or alive. It's basically just a particle of the virus that will be manufactured in the body. So you can consider it as a vaccine that cannot give you COVID, but it doesn't fall under that old classification of live virus or dead virus, because there is no virus. They're just taking a small piece of mRNA, which is, you can say it's a small part of the body of the maybe the virus. That's it. There is no virus involved.
Fine. Jazakallah khair, Dr.
Okay.
First of all,
I request
thank you very much, Dr. Suhail and Dr. Altaf and Dr. Hamid. May Allah bless you. Jazakallah khair.
Most welcome.
Dr. Sir, one last question, which is a very generic question. Dr. Suhail, this is Dawood Sharif.
Yeah, please.
Yeah, one generic question. Okay. During the, I think there is a lot of disturbance.
I don't know, not able to trace from where the source.
Okay. So the question is to both the doctors. What was happening is, during the first wave of COVID, when a patient was positive and then he recovers, they used to test him after 10 or 14 days, and they used to do a RT-PCR test and see whether and they used to gauge his CT levels, whether he'll be able to spread it to others or not. But now, because of the overwhelming amount of patients which are available, even the RT-PCR test is not being conducted after 10 or 14 days. And we are not sure whether the people are able to spread it or not. So ideally, what is the cutoff time after which a COVID positive patient, when he recovers, he will not be a spreader?
Well, Amir, shall I take it?
Yes, please, go ahead.
So, see, actually, after the patient gets infected and he becomes symptomatic or is asymptomatic, normally infective period is just 10 days. Positivity can remain for weeks to months. So there's a reason why we don't repeat RT-PCR after the patient actually gets hospitalized. There's no need, even if he's positive, he's not infective beyond 10 days after he acquires infection. Am I actually...
Yeah, that helps.
Yeah,
Okay, now I request Saud Said Bhai. Saud Said Bhai wants to ask something. Please ask your question. Saud Said, are you there?
Assalamu alaikum. Suhail bhai, this is Ismail. Can I ask instead of Saud Said?
You cannot ask instead of... He has come. He has come. You can ask after him, please.
Yes, sir.
Can you hear me?
Yes, Dr. Sir. Test out. Ji.
My question is with Dr. Altaf Sahab. What we have been noticing here on the patients that during the process of the treatment and after a certain level the patient is stabilized, but yet the saturation is not come up, say to the levels of 92, 94 for them to say yes, now you can go home and relax. And a lot of patients are coming back at 85, 86 levels. Is this safe?
A very good question. The simple analogy I give to this patient and attenders is, a bimari, it is going to peak, going to plateau, then it's going to dip. And किसी को मुक्का मारत गिरते नहीं, किसी को छेद गिर जाती. All immune, actually how a body system reacts is different for different patients. It's like jaundice. कि पीलापन ज्यादा होता है, उसके बाद किसी का जानलेवा रहता है, किसी का पीलापन थोड़े में कम हो जाता है. The same thing analogy we can be for COVID. So basically, when they come, saturation is going to be more with passage of time. Actually, depending upon how they are reacted, hyper-reacted, inflammatory or hyper-inflammatory phase is going to worsen over period, and ultimately, depending upon the inflammation mounted in the lungs, upon the involvement of the lungs, and then actually followed by inflammation, fibrosis of the lungs, the saturation actually is going to dip, and ultimately, in 10%, which I have told you, these are the patients who are going to have saturation of about 90 and less than 90. And as aptly brought out by Dr. Hamid, saturation of more than 88 is fair enough for that patient unless if they become symptomatic or they have dyspnea, but preferably we keep more than 90, and that's the reason why we send these patients with home oxygen advice. Basically about 100 people, only 10 people they need home oxygen. That's what I have seen in practice. And then 10 people, we don't know which subset of patients they require for more than 2 weeks, 4 weeks. Ultimately, only time is going to tell us, because this inflammation and hyperinflammation is going to linger and ultimately may worsen with passage of time. Like thromboembolism, this also fibrosis can set in. So in such cases, we do use antifibrotic drugs for the lung, at the same time continue oxygen, and they may be oxygen dependent chronically for more than 3 to 6 months also. Okay. Hope I've answered your question.
Yeah. Now, I request Khadir Saab, because Khadir Saab is raising hands since long time. Khadir Saab, you can ask. Next, we'll go to Ismail Saab and Aziz Saab. Khadir Saab, please. Unmute kare.
Thank you so much, Dr. Saab. Thank you so much.
Assalamu alaikum warahmatullahi wabarakatuh. It is clear?
Yeah, clear. Go ahead, please.
जस्ट मेरा क्वेश्चंस पे नहीं है, समझो जस्ट मैं एक मोटिवेशन और टेक अवे होम देना चाहता हूँ मेरे भाइयों को पूरों को विद प्रैक्टिकल एक्सपीरियंस। ये कोविड 1.5 ईयर के बाद जो कुछ चीजें हैं विद प्रैक्टिकल जो चीजों के साथ में एक टेक अवे होम देना चाहता हूँ पूरे भाइयों को। अल्हम्दुलिल्लाह, अल्लाह ताला ये हमें एक अमानत, हमारा जिस्म जो भी हमने दिया ये एक अमानत है अल्लाह ताला की। हम इसकी एहतियात या साइंटिफिक जो भी वैक्सीनेशन है, जो भी जो चीजें हैं उसको एहतियात के साथ पूरी करना है। जरूरत जो भी डॉक्टर्स के एडवाइस वगैरह लेके इसको फॉलो करना है, एक अमानत है, हमें जान अल्लाह की अमानत है। इसको करते हुए फिर देखे अभी जो काफी डॉक्टर जो प्रैक्टिकल चीजें डॉक्टर रहते हुए डॉक्टरों को संभाल नहीं सक रहे, तो ये हमारा ईमान का एक ताजा है। अल्लाह ताला जिसका रिजल्ट जिसका ये खत्म कर देता है उसको हमें समझ लेना चाहिए। हम एक ईमान हमारा अपन और हमारे एक ईमान को ये ताजा करने की चीज है, और अल्लाह तवक्कल अल्लाह करे। जितना भी आप कोशिश कर ले ये कर ले, अल्हम्दुलिल्लाह जब उसका वक्त उसका रिजल्ट उसका हवा लिखा रह गया तब तक रहेगा। उसके बाद सारी दुनिया सारी साइंटिफिक कुछ नहीं बजा सकती। इसके ऊपर हमें तवक्कल करना चाहिए, ये मोटिवेट करके अल्हम्दुलिल्लाह चलना चाहिए। बहुत अच्छा डॉक्टर हमीद साहब ने बहुत चीजें ये की है, जज़ाकल्लाह खैर। और हाँ, जो आफ्टर कोविड जो पेशेंट अल्हम्दुलिल्लाह डॉक्टर अल्ताफ साहब ने बहुत अच्छे चीजें दिए, और हमारा कुरान और हदीस सुन्नत का ये करते रहे। देखिए अल्लाह सुब्हाना तआला ने आपको एक बहुत अच्छा मौका दिया है। आपको ये खिदमत करने का, ये करने के लिए, अगरचे अल्लाह ताला आपकी नियत करके जो लोगों का आप संभालेंगे, अल्लाह ताला आपको जो है लोगों को आप देखेंगे, अल्लाह आपकी हिफाजत करेगा। लेकिन जस्ट ये मेरा रिहाकारी नहीं, मोटिवेशन नहीं, अल्हम्दुलिल्लाह अल्हम्दुलिल्लाह अल्लाह के फजल से जो कोविड शुरू होते हुए यहाँ काफी अटेंड किया, काफी अल्लाह के तरफ से एहतियातन करके ये करके, लेकिन बस दूसरों की खातिर के लिए हम कुछ कोशिश करेंगे ना, अल्लाह आपको हिफाजत करेगा। इसमें अल्लाह का जो वादा है, जो आप दूसरे मेरे बंदों को आप देख लो, मैं आपको देख लूंगा करके, ये मैं पूरा करेक्ट मिसाल देना चाहता हूँ, क्योंकि यहाँ में 60+ हूँ और ऑल ओवर सऊदी अरेबिया फिरा हूँ और काफी पेशेंट को अटेंड, काफी लोगों को अटेंड किया हूँ, लेकिन अल्हम्दुलिल्लाह अल्हम्दुलिल्लाह अल्लाह के फजल से ठीक है। इसी तरह इंडिया में भी काफी चीजें करें, अल्हम्दुलिल्लाह। मैं कहने का मतलब यही है अब, लेकिन यहाँ पे 100+ से 100+ से 200 को ये मैसेज दे, 200 से 1000, जिस तरह से अब हम कोविड का दे रहे हैं, इसी तरह जो कौम की खिदमत, अपने पड़ोसियों को, अपने भाइयों को, इर्रेस्पेक्ट ह्यूमैनिटी को आप बचाएंगे, आप अल्लाह ताला आपको बचा लेगा इंशाअल्लाह। इस नियत से लेके आप चलेंगे तो इस तरह की जो अभी जितने भी आ रहे हो पॉजिटिव रहे, और जितना ये मीडिया ये सब देखने हर वक्त आप पॉजिटिव रहे, क्योंकि जो नेचुरल ह्यूमैनिटी जो बढ़ाने के लिए अल्ताफ साहब ने कहे, ये हर वक्त पॉजिटिव रखे और अपने फैमिली को पॉजिटिव बोले, अपने दोस्तों को पॉजिटिव देके लेके चलेंगे तो इंशाअल्लाह इस वबा से हमें निपटेंगे। और अल्लाह सुब्हानहू तआला इस चीज को लाया है, इंशाअल्लाह हम जो दुआ करके जो हम अल्लाह सुब्हानहू तआला और सुन्नतें जो सिखाए हमको, इस तरह से ये करके इस वबा को हम दुनिया से हटाने की कोशिश करेंगे। जज़ाकल्लाह खैर।
Okay, thank you very much, Khadir Sahab. Now I request Ismail Bhai to ask his question.
Assalamu alaikum all. Doctors, I wanted to ask this. I've been a psoriasis patient. You guys said that I am on a immunity suppressors like tacromid and all tablets. So you said Covaxin is the best if someone is on an immunity suppressor. But as of now, they are telling that Covaxin is not approved by WHO and WHO, and it has travel restrictions and all of it. So what do you suggest in that case? Should we go with Covishield, or can we continue and wait and take Covaxin? Please suggest. So, was I clear, or should I repeat?
You are clear. Yeah, Dr. Hamid Saab will answer.
That's a good question. To be honest, we don't have a lot of data. However, I can tell you that I've seen some recent guidelines. I don't know based upon what information they're saying this, but they're saying that even for patients who are immunocompromised, they have used the mRNA vaccines and they've been safe. As far as Covishield is concerned, I really don't know. It does use a live virus, but this is supposedly a harmless virus. But if you're immunocompromised with taking immunosuppressive medications, I would probably stay away from it at this point in time till we have more data. I don't know what is the restriction of Covaxin. I didn't get it. Is the government of India not allowing Covaxin?
No, actually, they have been in the newspaper and other places. They have been mentioning that WHO has not approved Covaxin, and I keep traveling to Dubai and other places.
Of course, yes. So
if I travel to Dubai now and I have administered Covaxin, then I might not be able to travel in future and all. So that's when I have not taken any dose till now. So I was not sure which one to take.
So if you want to travel, you're probably the best bet right now is Pfizer. So even us in the UAE, we have taken the Chinese Sinopharm vaccine because that was the only one available to us. And Sinopharm till now is not recognized in many parts of the world. And so I'm facing the same problem that you are. If I have to travel anywhere, I'm required to quarantine because they don't recognize my Sinopharm vaccine. On the other hand, many countries have started recognizing Pfizer. So you really don't have much of a choice over there. I would suggest if the Covaxin is available, take it. They're also, in future, if you get something else available to you like Pfizer, you can also take that. And this is what a lot of people over here are doing, including some of my colleagues, and including I myself plan on doing that. I have taken what was available to me before, and as soon as Pfizer will be available to me, I will take that as well. mainly because this will help me travel, just like you are pointing out in your case as well.
But doctor, then what duration in between? Let's say if I take Covaxin now, how many days later or after what duration can I take Pfizer? Because as of now, Pfizer is not available in India.
Right. So again, we don't know the answer to that, but I can tell you what people are doing. People over here, after having taken their second dose of the Sinopharm vaccine, some people are waiting 3 months, some people are waiting 1 month. But again, we don't have any data to support this. What I can tell you is the ones who have taken have not had any problems. But this is a very, very small sample size. Again, I'm talking without any evidence to back me up.
Okay, got you. But strictly Covishield is going to cause a problem for a person with psoriasis.
Again, it's not clear that it will, but since it does have a live virus, I would probably stay away from it till we have more data. I don't know the answer to that for sure. Not having an answer does not mean you cannot take it. All I'm trying to say is I don't know.
Got you, doctor.
Yeah.
And one more quick thing. I really want to thank all the doctors and the organizers. It was really, really informative. I was glued to this from a very long time. I really want to thank, and it was really helpful. Thank you.
Thank you very much. We thank you to participating in this meeting. Thank you very much. Now I request Azizur Rahman Sahab. He wants to ask Azizur Rahman Sahab.
Jazakallahu khair. Thank you very much. Dr. Suhail, I have been waiting patiently and you have given me an opportunity. Thank you very much. Assalamu alaikum, everybody. It seems Dr. Altaf is not available on the line, but
he is there. Dr. Altaf Sahab is there. Only thing is, okay. Now he's unke didar nahi ho rahe the bas.
Okay. Dr. Sahab, assalamu alaikum wa rahmatullahi wa barakatuh. I am from basically from Anjuman of Khuddam al-Muslimin, as you very well know. And it has been a very long time that we have met, inshallah. The question which I want to pose to you is that I was not able to take the vaccine just before because Ramzan was on the line, you see. So I thought of taking it after Ramzan. But now things are getting confusing because this is available and that is not available. If I take Covishield and Covaxin is available, Covishield is not available after 6 to 8 weeks. Or maybe from 12 to, so I am in a little confusion. That is one question. And the second question is, my wife is a diabetic patient from the past 4 years or 5 years. And she is having the diabetes varies from 200 to 250, but she is able to maintain it completely. She is a little, scared of the situations which are arising now and news and WhatsApp messages and this, that, everything coming into the picture that diabetes patients must or must not take. This is the question I'm asking to you.
Dear Hamid.
I thought the question was for you, but I'm happy to answer. The second part of your question, I believe, was your wife is diabetic and can she take the vaccine? That's perfectly fine. That's perfectly fine. There's no problem taking the vaccine, either vaccine. It should be okay. There should be no problem. And many diabetic patients have taken a lot of these vaccines, and alhamdulillah, they haven't had any problems. In fact, I would argue the other way around, that since she's diabetic, it is more important that she takes the vaccine, because if she gets COVID, her COVID may be more serious than the average person.
Okay.
And what was the first part of the question? Sorry.
The first part is now it is a kind of a very varying situation. That this is available, Covaxin is available, and Covishield is not available.
Right. Okay.
If I go for one and then if I'm not able to get the other one after 6 to 8 weeks, then what I should do?
I would say
in Saudi Arabia, the same thing happened. They started with Pfizer, first dose. For second dose, it was not available.
Okay.
Please, Dr. Saab.
Yeah, I would suggest take whichever one is available right now. Don't delay this, because let me tell you, even say for whatever reason, Khuda na khasta, you are only able to take one dose, even that will provide you benefit. That will provide you some degree of immunity. If you take the second dose, your course is now complete. But even with one dose, you will have protection. That is better than nothing.
So the vaccines
available to you right now.
The vaccines which are available are of the same quality or the same contents or different?
Covaxin or Covishield are different. They're both different.
Okay.
They're both different vaccines. If you take any one of them, you should ideally take the same one after the duration recommended by the company, which I believe it is 2 or 4 weeks. But even if you take it 5 weeks or 6 weeks or 8 weeks, it's okay. It's okay. If you start
Thank
a
you so
second
very much.
vaccine, then you will have to start it all over again.
Okay, thank you so very much, Dr. Altaf and Dr. Hamid.
Yeah.
Dr. Suhail, thank you so very much for giving me this opportunity. Thank
Jazakallah
you, sir.
khair for participating in this meeting. Jazakallah khair.
I have been there from 7:30, sir.
Yeah, okay. Thank you very much. Thank you very much. I request now Galaxy A70. He's also standing in the queue from long time. Galaxy A70. I don't know the name. Are you there? Okay, we'll go to Miss or Mrs. I don't know. Yasmin, please ask your question. Yasmin.
Assalamu alaikum, Doctor. Yes. Am I audible?
Yeah, you are audible. Go ahead.
First of all, Jazakallah khair for the extreme, so much of patience, for taking time out to answer all our queries, for staying for so long, almost so many hours. Alhamdulillah. Allah reward you all for this immense effort. Doctor, my question is like a person has not yet taken the vaccine, and if the person does not know if he or she is right now COVID positive, maybe they are asymptomatic or something like that, they have no symptoms, but they just go and take the vaccine. Is that okay? Is that safe?
That's absolutely safe.
Okay.
Yes, you can take the vaccine. Yes.
So there are no restriction on Covaxin and Covishield and all. So any vaccine.
No, you can take any one that is available to you.
All right. Okay. Thank you so much. Jazakallah.
Sure.
Okay. Now I think we should go to the last part and end the session. Now I request Dr. Salim Mekri Sahab to give a vote of thanks, and so that we'll conclude the meeting. Doctor, please unmute yourself. Dr.
Assalamu alaikum.
Wa alaikum assalam.
I'm very happy to see so many participants here. I'm very thankful first and foremost to Allah subhanahu wa ta'ala that He gave us an opportunity to assemble here and hear two very good doctors, very professional and very highly qualified doctors, both in their respective fields. We are enlightened and it was very informative. Most of the people got to know a lot of things from this. I'm very happy to see a lot of doctors here. They are very patiently hearing them. And like Dr. Naushad Piran, Dr. Kareem, Dr. Wajahat, and so many other doctors. It's really commendable that my BENFA has arranged such a good meeting. All laurels go to our president, Dr. Suhail, for arranging it in such a short time. And many more people wanted to join. But in this, Zoom, I think 100 was the limit. But in YouTube, many joined. If you had made it a Microsoft group, many more people would have joined there. But still, it was really great achievement. And we actually planned it for 20 minutes Hamid, 20 minutes Dr. Altaf, and 10 minutes question and answer. But just look at the seriousness of the subject and the people interest. It took 3.5 hours to complete the program. And still many people are raising their hands to ask the questions. That shows how successful this program has been. Inshallah, I will carry forward. Two things I want to say here. One is, as Dr. Hamid said, vaccination is very important. After hearing Dr. Altaf's post-COVID complication, now everyone is convinced that yes, vaccination is a must. We have to take vaccination. I have already taken, but we have to tell everyone else that yeah, you take a vaccination. It's very important. Otherwise, you'll get COVID and COVID complication. To avoid that, take vaccination. This is very important. We will have to just propagate this YouTube as much as possible, make it viral. Everyone has to
listen to this and take vaccination. And second point, what all complication Dr. Altaf said were very informative and very educative, and everyone has to think about it. It is not easy to have COVID. Even if you recover from COVID, you have such a long list of complications. Apart from medical complication, the people who are becoming orphan and widows is a big thing. And here BENFA comes into picture. BENFA has to join hands with Shifa and other groups to make some rehabilitation program to these orphans, to these widows, and do something to our community. This is a must in post-COVID situation. There are good hospitals, there are very good doctors, wherein they'll manage the medical issues, the psychological issues and all that. But rehabilitation has to be done by NGOs. So every NGO has to come forward and take part in rehabilitating these widows and orphans. It really hurts me to see that what will happen after a few months, where all these people will go. I see families devastated. 2 people dying in one house, 4 people dying in one house. The father, mother is gone. Children are just nowhere to go. Otherwise, children are dying. There is no father and mother. They are just alone at home. No one to look after them. Old people. What is happening? It's all from Allah. We know it's all from Allah. बहुत बड़ी आजमाइश है हमारे लिए. इसके लिए हम लोग जैसा हमारे खदीर साहब बोले कुछ ना कुछ करना है. जरूर करना है. इसमें BENFA will be in the forefront, inshallah. We have got a very dynamic president in Dr. Suhail. Inshallah, will carry forward. We'll take advice from Dr. Altaf, Dr. Hamid, and all the other people working here and do something in this regard. Thank you for giving me an opportunity to speak. Jazakallah khair.
All the praise to Allah subhanahu wa ta'ala, who is Lord of the worlds. I request Dr. Altaf Sahab to make a dua for us so that we'll conclude the meeting.
اللهم صل على سيدنا مولانا محمد وعلى ال سيدنا مولانا محمد بارك وسلم. جزا الله أن محمدا ما هو أهله صلى الله عليه وسلم. لا إله إلا الله الحليم الكريم. سبحان الله رب العرش العظيم. الحمد لله رب العالمين. نسألك موجبات رحمتك وعزائم مغفرتك والغنيمة من كل بر والسلامة من كل إثم. لا تدع لنا ذنبا إلا غفرته ولا هما إلا فرجته ولا حاجة هي لك رزق إلا قضيتها ويسرتها يا أرحم الراحمين يا أكرم الأكرمين يا ذا الجلال والإكرام يا حنان يا منان يا بديع السماوات والأرض أنت ولينا في الدنيا والآخرة. توفنا مسلمين والحقنا بالصالحين. توفنا مسلمين والحقنا بالصالحين. اللهم اهدنا واهد بنا. اللهم اهد الناس جميعا. اللهم طهر قلوبنا من النفاق وأعمالنا من الرياء وألسنتنا من الكذب وأعيننا من الخيانة فإنك تعلم خائنة الأعين وما تخفي الصدور. رب ارحمهما كما ربياني صغيرا. ربنا اغفر لنا ولوالدينا وللمؤمنين يوم يقوم الحساب. ربنا اغفر لنا ولوالدينا وللمؤمنين يوم يقوم الحساب. ربنا هب لنا من أزواجنا وذرياتنا قرة أعين واجعلنا للمتقين إماما. اللهم طهر قلوبنا من النفاق يا حي يا قيوم برحمتك نستغيث. أصلح لنا شأننا كله ولا تكلنا إلى أنفسنا طرفة عين. ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين. ربنا اغفر لنا ولإخواننا الذين سبقونا بالإيمان ولا تجعل في قلوبنا غلا للذين آمنوا ربنا إنك رؤوف رحيم. اے गुनाहों को माफ फरमा, खताओं को दरगुजर फरमा, रहम का, करम का, आफियत का, फजल का, इनाम का, इकराम का, अफू का, दरगुजर का मामला फरमा. ए अल्लाह जे सारी दुनिया में सारी इंसानियत अल्लाह परेशान है. ए अल्लाह जो है वबा से सबको खलासी नसीब फरमा. ए अल्लाह ये बीमारी से सबको खलासी नसीब फरमा. बीमारी भी तेरी रहमत है अल्लाह, लेकिन इस बीमारी की रहमत को बर्दाश्त नहीं कर सकते. अल्लाह बीमारी की रहमत को अल्लाह सेहत की रहमत से बदल दे, आफियत की रहमत से बदल दे. ए अल्लाह जो है तेरी अल्लाह जो है अल्लाह रहम का मामला फरमा. ए अल्लाह जो है जान कर अनजाने में, सुबह दिन में, रात में, सुबह में, शाम में अल्लाह हमने तेरे नाफरमानी की, अल्लाह में माफ फरमा. अल्लाह सारी उम्मत के अल्लाह जो है अल्लाह तरफ से हम तुझसे भीख मांगते माफी के. अल्लाह तमाम उम्मत के तमाम अफराद को माफ कर दे. सारी इंसानियत को ईमान से माला माल फरमा दे. मुसलमानों को दिन पर चलना आसान कर दे. ए अल्लाह जो है सारी दुनिया के हर घर को अल्लाह जो जन्नत का नमूना बना दे, जहन्नम का नमूना बनने से हिफाजत फरमा. सारी दुनिया के इंसानों के ईमान से माला माल फरमा. अल्लाह हमारे जुड़ने को कबूल फरमा, कहने सुनने को कबूल फरमा. जो कहने सुनने में कोताही गलती हो गई उसको माफ फरमा। अल्लाह जो बातें अल्लाह खैर के हमारे सामने आई हैं अल्लाह इसकी आबियारी फरमा। अल्लाह इसको फैला दे, हक्का बोल बाला फरमा, बातिल का मुंह काला फरमा। अल्लाह जो भी शर वजूद में आया है इसका अल्लाह इसको खत्म फरमा। अल्लाह इस दुआ को अपने फजल से कबूल फरमा। अल्लाह जिन्होंने दुआ के लिए दरख्वास्त की है या अल्लाह उनका हक है, अल्लाह तमाम के जायज़ मुक़द्दस को पूरा फरमा। अल्लाह तमाम जितने अल्लाह इस बीमारी से अल्लाह बीमारी में शहीद हो गए, अल्लाह जो है इनको शहादत दर्जा नसीब फरमा, आला इल्म में मकाम नसीब फरमा, अपने मुकर्रब बंदों और बंदियों में शामिल फरमा। अल्लाह उनके जो है अल्लाह मुताल्लिकीन को अल्लाह सब्र जमील नसीब फरमा। अल्लाह एक हसीन मौका हमारे हाथ है, अल्लाह ये खिदमत को हाथ से जाने ना दे, इसकी हमें तौफीक नसीब फरमा। एक लम्हे को वसूल करने की तौफीक नसीब फरमा, सारी मखलूक को राहत पहुंचाने की तौफीक नसीब फरमा, तुझको राजी करने के लिए अल्लाह ये काम हमें करने की तौफीक नसीब फरमा। ए अल्लाह बेनफा के तमाम अल्लाह जितने जे अल्लाह मेंबर्स हैं और जो हजरात अल्लाह इस मेहनत को किया जोड़ा, अल्लाह तमाम को कबूल फरमा, इनके अहल अयाल को कबूल फरमा। अल्लाह तो इनसे जो है बड़े बड़े काम लेने के फैसले फरमा। अल्लाह दुआ को अपने फजल से कबूल फरमा। रब्बना तक़ब्बल मिन्ना इन्नका अंतस समीउल अलीम व तुब अलैना इन्नका अंतत तव्वाबुर रहीम। सुब्हान रब्बिका रब्बिल इज्जति अम्मा यसिफून, सलामुन अलल मुरसलीन वल्हम्दुलिल्लाहि रब्बिल आलमीन। जज़ाकल्लाहु खैर। सुब्हानल्लाहि व बिहम्दिही, सुब्हानकल्लाहु व बिहम्दिक, नशहदु अन ला इलाहा इल्ला अंता, नस्तगफिरुका व नतूबु इलैक। जज़ाकल्लाह।
Thank you very much. Thank you one and all. With everybody's permission, I shall end the meeting now.
जज़ाकल्लाह।
अच्छा YouTube नहीं कर रहे तो YouTube का बोलना था, YouTube लिंक में शेयर नहीं करे क्यों? भेजा था YouTube तुम्हें पहले जरा देख लेना था, रिस्पॉन्सिबिलिटी लेना था। तभी से लिंक, ये लिंक है नहीं, पहले ऑन करको निकल बनाना से लिंक है, समझ में आया? फोन करना करको कहीं बाद में भेजेंगे तो तुम्हें भेजना था तो क्या बोलते हैं 10 सेकंड का काम कर दो। क्या? तो क्या होगा? क्या? ठीक है भी, सिर्फ घुसे नहीं हो। एक कौन सा तुम्हें ऑपरेशन यहाँ करना है, सर्जरी करना है। ये 10 सेकंड का काम होता है। रिस्पॉन्सिबिलिटी का लिए कि मतलब रिस्पॉन्सिबिलिटी कर को Oh my God.